morning, everybody. Welcome to the August 4th board meeting of the Physician's Assistant Board. I'm calling it to order as president, Juan Armenta, so we are now in session. So please, if we can call the roll.
Charles Alexander,
Present.
Juan Armenta,
Present.
Jennifer Carlquist,
Present.
Sonia Early,
Present.
Randy Hawkins,
Here.
Jed Grant,
Present.
Diego Inzunza,
Present.
Vasco Dion Kidd,
Present.
Deborah Snow.
Okay, that completes the roll, I believe, right? Ms. Caldwell, you good with the roll?
That completes the roll.
Thank you. Okay, so the number 3 item on the agenda is consideration of approval of the board minutes from their prior hearing. Does any board member have any comment on the prior board minutes? Very well, hearing none. Is there any public comment on the prior board minutes? By the way, do we also have online for board, for public, or just live today?
Just like.
Call in, no.
Okay. Well, hearing no public comment then, is there a motion to approve the board minutes?
I'll make a motion to approve the minutes.
I'll second.
Very well, we have a first and second. So if, Ms. Caldwell, if you will call the vote, please.
Charles Alexander,
Mr. President, can you hear me?
Yes, Mr.
This is Michael Canotes. We should ask for public comment on the motion as well.
Oh, very well. So the motion is
Very brief.
pending to approve the minutes. Is there any public comment on that? Hearing none, can you call the vote, please, Ms. Caldwell?
Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza,
Aye.
Vasco Dion Kidd,
Aye.
Deborah Snow. That concludes the vote.
Thank you very much. Very well. Item number 4 is public comments on items not on the agenda. Is there any comments from the public that would be like to be made? Very well. Hearing none, we'll move on to the number 5, which is the President's report. First of all, I'd like to welcome all the board members and the public here to San Diego. I hope you enjoy the wonderful weather that we have in San Diego. And also want to announce that typically we are carrying on with our typical arrangement of the executive officer informing the president, vice president biweekly of the status of board operations. I think that's very useful, and it has proven to be quite successful. The next item I'd like to announce is that board member Vasco Dion Kidd has been reappointed. Congratulations, sir.
Thank you.
I'd like to read a bio for, has been provided to me. Vasco Dion Kidd, PAC, has been reappointed by Governor Gavin Newsom to the Physician's Assistant Board. Dr. Kidd has been an associate clinical professor at the University of California Irvine School of Medicine, Department of Orthopedic Surgery since 2021, and director of the Advanced Practice Providers Program at UCI Health since 2019. Dr. Kidd was director of Advanced Practice Providers and director of Physician Assistant Orthopedic Surgery Fellowship Training Program at Arrowhead Orthopedics from 2016 to 2019. He was assistant professor and academic coordinator at Moreno Valley College from 2013 to 2015, and at the University of Texas Health Science Center from 2010 to 2012. Dr. Kidd was lead physician assistant at Kaiser Permanente from 2003 to 2010. He earned a Doctor of Health Science degree in Health Science Services from A.T. Still University, a Master of Science degree in Health Professional Education from Western University Health Services, and a Master of Public Health degree from UCLA. He is a member of the California Academy of Physician Assistants and American Academy of Orthopedic Surgeons, American College of Healthcare Executives, and Advanced Practice Provider Executives. His term will be from 7/28/23 to 1/1/27. Congratulations, sir, and I don't know that we have a flag up here for a nice backdrop, but
Thank you, President.
I'd like to administer you the oath for the office. Please,
Did you want to move here? That way we can take a photo. In the middle?
in the middle,
Yeah,
let's do that.
please.
Okay, so we can move a photo.
Congratulations, Dr.
Thank you.
King.
Congratulations. All right. Please repeat after me. I, Vasco Dion Kidd, do solemnly swear or affirm
I, Vasco Dion Kidd, do solemnly swear and affirm
that I will support and defend the Constitution of the United States
that I will support and defend the Constitution of the United States
and the Constitution of the State of California
and the Constitution of the State of California
against all enemies, foreign and domestic,
against all enemies, foreign and domestic,
that I will bear true faith and allegiance to the Constitution of the United States
that I will bear true faith and allegiance to the Constitution of the United States
and the Constitution of the State of California,
and the Constitution of the State of California,
that I take this obligation freely
I take this obligation freely
without any mental reservation or purpose of evasion,
without any mental reservation or purpose of evasion.
and that I will well and faithfully discharge
I will well and faithfully discharge
the duty upon which I am about to enter.
the duty on which I'm about to enter.
Congratulations, sir.
Thank you, appreciate it.
Okay, very well. That concludes the president's report, and that will move us right into our executive officer's report. Ms. Khan.
Good morning, everyone. Can you hear me?
Yes.
Yes, okay. I'll start off with personnel. On March 27, 2023, interviews were conducted to fill the vacant office technician position, which will provide technical and clerical support to the enforcement and licensing programs. A candidate was selected, however, due to lack of response, the position has been reposted to increase the candidate pool. Additionally, recruitment is underway to fill the vacant administrative office technician position. An update regarding the vacant positions will be provided to at the next board meeting. Next item is annual report. The board staff is working diligently to submit its fiscal year 22-23 annual report to the Department of Consumer Affairs. The annual report is an opportunity for board to demonstrate its accomplishments, provide program information such as position counts, board membership, license requirements, fees, continuing education, licensing and enforcement statistics, and regulatory and legislative updates in the past 12 months. The report will undergo DCA's review and approval process before its publication. Next item is outreach. Staff attended the Administrators in Medicine and Federation of State Medical Boards FSMB 111th annual meeting on May 3rd through the 5th in Minneapolis. The FSMB is a national nonprofit organization that represents the 70 state medical and osteopathic boards of the United States and its territories. The event provided valuable platform for colleagues in medical licensure, regulation, and discipline to learn, interact, and deliberate upon the pressing issues confronting medical regulators. A diverse range of topics pertinent to medical regulation was covered, fostering an environment of knowledge sharing and collaboration. The next item for outreach is board staff is looking forward to attending the annual California Academy of Physician Associates CAPA conference during Physician Assistant Week, October 5th through the 8th. In Anaheim. This event allows for crucial outreach and presents the invaluable platform for board staff to address inquiries from licensees and students and provide updates regarding laws and regulations governing the PA practice. We appreciate the opportunity afforded to us by CAPA to attend this exceptional event. Last item is the information technology. In collaboration with DCA's Office of Information Services, the board modified Breeze to allow licensees to print their own pocket license from their online Breeze account. This change offers convenience, cost efficiency, immediate access, and benefits the environment as we find more ways to reduce our environmental footprints. Additionally, DCA's license search tool is available to verify a license in real time or any time the status has changed. Consumers, employers, or any interested party can verify the license status online 24 hours a day, 7 days a week. Lastly, the board continues to utilize its subscriber alert system, social media accounts, and website to maximize outreach, which serve as the primary communication tools for licensees and members of the public. That concludes my report.
Thank you, Ms. Khan. Any comments from the board?
Hawkins, question.
Yes.
How many vacancies in what area do you
They
have?
are support staff, OT position, so front desk, and then we have, this is a new position that we created. This was a budget change proposal that was approved. It's for enforcement and licensing support.
Thank you.
Any other comments or questions? Any public comment or question? All right, very good, excellent. Thank you, Ms. Khan. Okay, next we move to board activity reports. The first one is licensing. Ms. Caldwell, please.
Okay, good morning.
Good morning.
I do not have my laptop in front of me, so I apologize if you guys have that up, but if it's, you do have a paper copy of it if you want to follow along in the meeting material packet. It's right after Rosanna's report. But the first report is the licensing population by type. So this just breaks down the different types of licensing types that we have, and the status. So current, and active are typically what we're looking at. The volume is, current temporary family support. We have 16,896 licensed individuals that are current, and active, or current temporary family support. But the key shows you the different statuses as far as retired, delinquent, so on and so forth. And this was as of, the report was ran on July 17th, so this is a current, accurate count as of that date.
Ms. Caldwell, I have a question, and
Uh-huh.
this came across in another context. How are we reported deceased license members? How does
So-
that get reported to us?
When an individual passes away, either the family member submits, it's usually not the individual, but the family member will submit. You know, the brain was catching up with the mouth there. So typically what it stems from is they're getting a notice that they need to renew or they're delinquent and renewing. And so they'll contact the board and then we'll walk them through on how to remove the requirement to renew, just close it out and show it as a deceased license so that the public has that information when they're going to view it. Or if there, you know, there's a complaint that's delayed in filing, everybody has that information. So it's nice to have that if they follow through, but it's not required of the family or friends of a loved one that passes away. But that's
Okay.
how we get those into the system.
And we haven't
We
seen
get a
any
death- a
problems
death
with a
certificate.
license out there that is of a deceased licensee, that the license lingering has not been any problems that we've ever
Not to my
seen.
knowledge.
Okay,
yeah,
very
not to
good.
my knowledge.
Thank you.
Okay, so the summary of the licensing activity, that gives you a glance between April 1st, 2023 and June 30th, 2023. We had 476 individuals apply for an initial license, and we approved 409 of those applications. That 476 is not necessarily depicts the 409 out of that pool. That's just who we had in the system at that time. And then we had 1,902 individuals renew their license. Any questions on that one? Okay. The next report is the pending application workload. And again, this gives you a glance as comparing the applications that are in process. These are just applications that we received payment for. We have applications that have, that are in our workload. So we have a workload that we can see, and it will tell us if the application's been paid for or not paid for. And those that are not paid for, we don't consider them complete, so we don't review them or move forward with processing them. So this report is only depicting individuals who have applied and paid for their application. And the desk age is how long it's been assigned to a specific staff member. The 0 to 30, 31 to 60, again, those numbers just, they don't reflect on how long it's taking us for how long it's taking staff to provide that initial review and update to the applicant. This is how long they're sitting in the drawer for. And this is based on, maybe they've applied really early, maybe a month or two prior to graduating from school or taking the exam. Somebody that's having difficulty getting their background check completed, their cards have been rejected, we have to send the subsequent card, and then they have to do a name check. And that can take the process anywhere from 2 to 4 weeks to about 3 months. Sometimes it's difficulty getting verification. Sometimes it's just getting an explanation of why they answered something. They're not realizing that they didn't, So what we do as staff, my licensed analyst and myself, is we do provide them updates. If the application's been stagnant for 3 or 4 months, if it's something other than the PANCE score, because I don't want to pressure somebody on like, your application's pending because you haven't taken the PANCE, because that's up to you to determine when that's a good fit for your schedule and your readiness for that. But anything else like a verification, or we haven't gotten the fingerprint cards, the program certification, those are the things I'll just do a gentle reminder to say, we've had your application on file now for a little while. I just wanted to let you know we're still missing these items. And so we try and do frequent updates, or infrequent, I guess, because 3 to 4 months wouldn't be a frequent update. But due to the workload, we try and review the drawer occasionally to see how we can, just gently remind them. And then we do let them know that if they're not ready to move forward at this time, they can always withdraw and reapply later on. So that's helpful. And then the next page is the application age, and again, that's when it's assigned to a staff member. Any questions on that one? Okay. So the licensing performance measures, that's what helps us to determine if we're meeting that target goal of 30 days. That as board staff, we've self-imposed that we'd like to have the review to the applicant within 30 days of them applying and paying for their application. And so that just gives you a good indicator that we're meeting that. And how many applications? So complete applications, that typically means we review the application, they're ready for licensure, they get licensed. Incomplete applications just means they have deficiencies. So, and that's what creates that pie for the pending application workload and why they're moving from one shade color to the next. And as staff, we're continuing to do audits on the controlled substance education course. There's been a little bit of confusion lately with the implementation of the DEA requirement now, their 8-hour requirement for their course. So we're just answering more questions about, whether or not it's up to, whether or not their course that they complete for the DEA also fits the needs of the board. So we're just pushing back and saying, here's the regulations, we'd like you to read through them and understand. If you have any questions, we answer them, and hopefully, I don't have the answer for whether or not one course meets everything. We just redirect them to the DEA to say, help them clarify what's required for the board, what's required by the DEA, so.
Vice President Early, do you have a question?
Yes, with our increased number of physician assistant schools in California, have you noticed an increase in the desk age of the applicants?
No, yeah. So the desk and the application age are really just depend upon how long the application takes to approve. Some of them never get approved because they expire because individuals don't complete the application. So those are the ones that are hanging out in that 90+ category.
Right.
But yes, the increase in applications based on the increase in the education institutes in California, we still meet the need of reviewing them within 30 days and providing them with an update. So the workload is manageable. Jennifer, who has onboarded, I think in, correct me if I'm wrong, March, April? March. Okay, she's been amazing. She's caught on very quick, and she's very efficient, and we're maintaining that 30-day window. I think right now we're a little bit under that 30-day window, so it's really nice to have the additional staff to assist with the workload.
Excellent.
As well as Christy, I have to put in
Yeah.
a kudos to Christy. She's been amazing. She really does help out in the office when I work from home. So it's really nice to have that backup. Yes.
All right, thank you.
Uh-huh.
Any other questions?
I have a comment, not a question. Is that
Please.
okay? I just want to thank the licensing team, you and everyone else doing licensing. It's really encouraging when we get things like requirements for expedited licensing and things like that that come from the legislature, and we are always already meeting those requirements because our licensing happens so quickly. So just appreciation for your hard work
Thank you.
and that and your team.
Yep, thank you.
Thank you, Member Grant. Any other comments? Okay, great. Thank you, Ms. Caldwell. All right, 7B would be the complaints. Mr. Melendez.
Good morning.
Good morning.
Okay, I will be providing you a section of enforcement activity report in regards to the complaints for the fourth quarter. We will be focusing on the fourth quarter of April 1st, 2023 to June 30th, 2023. As you can see on the chart, we have also provided stats from previous quarters. This report will show how we are trending this fiscal year to last fiscal year. Let's start off with complaint volume. We have received 96 for the quarter. We have received 7 complaints for convictions, arrests. We have a total of 103 complaints. Intake. We had 111 cases assigned to the desk analyst. 0 complaints are pending at the intake level. Complaints and investigations. We have 14 complaints were referred for investigation. We have 130 complaints pending at the desk. Excuse me, we have 130 cases complaints and investigations closed. We have 284 complaints pending at the desk analyst. 54 cases are investigations are pending at the field. Investigation aging. The average age of pending investigations are 327 days. Investigations over 8 months old there are 39 cases right now. I would like to move on to the following chart. The following chart is on the complaints received by type and source. This concludes my portion of the report. Thank you.
Thank you, Mr. Melendez. Any comments or questions on the complaints section of the agenda?
I have a question.
Sure. Please.
So on your investigations aging, they're relatively small numbers, so the percent change looks outsized.
Yeah.
Just wondering if you have adequate support to make sure that those are moving through in a timely fashion.
Yes, sometimes the aging on cases, like say if they're criminal, they were pending, some of the cases are pending disposition change, and that causes it causes for them to be aging just for that alone, and that changes as it's been changing as now we're at the end of pandemic's over. Things are starting to change, they're being processed sooner, so that number should be reducing for that part. But there's other cases that still take time if there's, I'm not talking about a particular case, but we'll just say like fraud or other types of cases, domestic violence, something that can take longer, those will continue to age.
Okay, thank you. I think I understand there's a lot of external factors beyond your control in terms
Yeah.
of how long it takes cases to progress
Yeah.
through there. I just want to make sure that you have adequate support in terms of staff and things like that, because that's the part the board can really have some control over. So if you're short-staffed or need additional support somehow that maybe we could help you with, wanted to make sure you had an opportunity to ask for that.
Yes, we are working on that. Hopefully with the support staff that we get, it should help out. And I have some of my colleagues chipping in as well to help me out with some of the workload.
Yeah, we have something in the works, so once it's finalized, there's going to be additional staff added to that unit.
Okay, thank you.
Thank you, Member Grant. Any other questions or comments? Please,
Yeah,
Dr. Alexander.
Mr. President. I just have a question about the complaints received by type and source. I noticed like an increase in gross negligence from the public. And also, it seems like government agencies are reporting more complaints. Is there any information you can give us about those increases,
From other agencies?
or what you're seeing in terms of, is it, I'm just wondering if it's people coming out of the COVID environment, and now we have more people.
No, that hasn't changed much. Other agencies, we get a lot of referrals from medical board cases. Say if there's a PA that was working with an MD, or they file it against the MD and then they find out it's the PA, they'll refer cases to us. I couldn't tell you an average number that we get a week. Maybe we probably get, I would say, at least 3 or 4.
Okay. And I take it public as individuals calling the board.
Yeah, we also take in, we take from the public, they come in either by phone, by emails, and just online. If I can, I don't know how else I can talk about that, but if you have a specific question on what type of, because gross negligence is a kind of broad, it's a quality of care issue mainly.
Okay, thank you.
Mm.
All right, thank you, Dr. Alexander. Any other comments or questions? Very good. Thank you, Mr. Melendez.
Thank you.
Okay, the next section is discipline.
Good morning, everyone.
Good morning, Ms. Hale.
So I'm going to be presenting the discipline statistic report for the fourth quarter and trending from this fiscal year to last fiscal year. For the suspensions, the automatic suspension orders, there's no change in that. Cease practice, there was no change as well. For an interim suspension order this fiscal year, we did not have any. There was one trending from last year, there was one. For the Penal Code Section 23 orders, this quarter there weren't any, but for the fiscal year there was one, which is down from last fiscal year. For the Office of Attorney General transmittals, the cases initiated for the fourth quarter were 8. For the total fiscal year, there were a total of 36. Trending from last fiscal year, it was down. For cases pending, there were there's 43 in the fourth quarter, and then for the whole fiscal year, it's 43, which is pretty equal to the last fiscal year. For the average age of pending cases, there was 330. It's 330 for the fourth quarter. Fiscal year, it's 330, which is up from last fiscal year. And so the next section is the formal actions filed, dismissed, or withdrawn. For the fourth quarter, there were 7 accusations filed. For the total fiscal year, there were 20, which is up from last fiscal year. For accusations and petition to revoke probation, there were 2 this quarter, the fourth quarter. For the whole fiscal year, there were 4, which is up from last fiscal year. The accusation withdrawal dismissed, there were none this fiscal year, and there were 2 from last year, so we were down this fiscal year. For statement of issues filed, we had 1 this quarter, and for the whole fiscal year, it was that 1. For the statement of issues withdrawn or dismissed, there's no change. For the petition to compel physical psychiatric exam, there were none this fiscal year. Trending from last year, there was, it's down, there was 1. For the next page, the administrative outcomes and final orders. For license applications denied, there was none this fiscal year. Last fiscal year, there was 1, so it's down. For probationary license issued, there were no change, there's no change. For licensees placed on probation, this quarter was 5. The total for the fiscal year is 10, which is up from last year. And for public reprovals, there were none this fiscal year, and then down, of course, from last year. License revoked, there was none this quarter, but for the fiscal year, there were 4, which is up from last fiscal year. License surrendered, there were 4 this fourth quarter, with a total of 8 for the fiscal year, which is up from last year. For the petition for reinstatement granted, there were none this fiscal year, which is down from last year. So the petition for reinstatements denied, there were none this fiscal year, down from what was last year. Petition for termination of probation granted, there were none this quarter, but for the fiscal year, there were 3, which is like slightly down from last year. For the petition for termination of probation denied, there's no change. For the petition for modification of probation granted, there were none for this fiscal year, which is down from last fiscal year, there was 1. For petition for modification of probation that was denied, there's no change. And for others, there's no change. I'll move on to the citations. There were no citations issued this quarter, but for the whole fiscal year, there were 2, which is down from last year. Citations withdrawn, there's no change. The citations resolved and closed, there were none for the quarter, but total for the fiscal year, this fiscal year is 4, which is down from last year. For transmitted to AG for noncompliance, there's no change. For the pending, there were no citations pending for this fiscal year, but there was 1 for the for the quarter, sorry about that. And then for the fiscal year, there was 1. Fines, there were no fines this quarter, but total for the fiscal year was $1,000. For the fines withdrawn is no change. And for the fines received, there was none this quarter, but a total for this fiscal year was $7,000, which is up from last year. Does anybody have any questions or comments?
Mr. Hawkins?
Please.
Thanks for that report. Can you give us an idea of what category resulted in license surrender and revocation? Do you recall, is it basically 1 or 2 different types of things? I realize it's only a total of 8. But
There were some by a stipulation, some surrendered while on probation. So those are the 2. Is that what you're asking?
I'm asking about category of problem. Is it substance abuse or
Oh, I don't
sex with a
have those.
patient? Is
Yeah.
any of that, do you have any information
I
on that?
don't have that
Just-
information,
okay.
sorry. I can get that if you'd like.
All right. Thank you.
Okay. Any other comments or questions?
This is Dion. Thank you for the report. Looks like everything's trending down for the most part.
Yes,
So that's a good sign. So thank you to you and your team for your work that you do on
Thank
that.
you.
Appreciate it.
thank you, Dion. And congratulations, Dion.
Thank you.
Okay.
Okay, well, if there's no other comments, then Ms. Hayden, maybe you can move on to item 7D.
Okay, so for the probation activity, so for license canceled for the fourth quarter, there's 0, there's no change there. The probationers that entered probation, there were 5 this quarter. Probation completed, there were 2. Probation terminated, there were none. Voluntary surrendered while on probation for this quarter, there was 1. Active probationers, there are 35 this quarter. Probationers told, there are 9. And for the total probationers, there are 44.
I do have a question. What does told probationers mean?
Told as, I know, I'll try to give you my best answer. For my understanding, what told is, as an example, when they, I'm sorry, I'm freezing right now. When they're not practicing, maybe they're out of state, I believe. Does that sound right, Rosanna?
So Christina's presenting for.
For Ginger,
For
for
Ginger.
Ms. Gerard.
Ms. Gerard. So probationers, when licenses are placed on probation, and one of the stipulation is if they are not practicing or complying with probation or working for 2 years, they're now on tolling. And then that's when we can transmit to the AG's office for violation of probation.
Gotcha. Okay, understood.
So the diversion program activity report.
Yes, 7E, please.
So board referral, there was 1 in the quarter to Maximus. Entered Maximus self-referral, there were 2. There were none for completed Maximus. Applicant not accepted, there was one this quarter. Applicant public risks, there were none. For applicant withdrawal, there were none. Clinically inappropriate, there were none. No longer eligible, none. Participant, non-compliant, none. Terminated, 0. Withdrawn, 0. But the total active participants are 4. Ms. Gerard has asked me to read a statement regarding the diversion to you. She asked me to inform the board that I noted in our May 2023 Recovery Program Management meeting that Maximus staff said that they had attended national conferences in their field. At those conferences, it was discovered that the decrease in participation in diversion-type programs is a nationwide trend. The attendees at the conferences collectively speculated it may be pandemic-related. It was posited that as clinics and practices became short-staffed, other staff and employers possibly looked the other way at behaviors that would have normally trend to further action. So she wanted me to read that too, and if you had any kind of questions for her, that I can let her know, and she can address them at the next board meeting or email you any
Well,
responses.
I do have a comment on that, and that is kind of alarming, that practices are looking the other way to potential diversion situations. So I would just ask her, maybe for the next board meeting, to give us a report on her estimation if that is going to change. If the thinking is that that's going to change,
Okay.
since we're post-pandemic, and what responses we should be thinking about if their theory continues to pan out,
Okay,
that people are just looking the other way. So if she could just inform us a little bit so we can be ahead of the curve on what might be happening there.
okay. I'll definitely let her
I do
know.
have another question. Enter Maximus self-referral. It sounds like it means that the licensee reached out and decided to go into diversion themselves.
Correct,
Okay, well, that's certainly admirable.
yes.
Now, I don't want you to discuss specifically, but can you tell us what does not accepted mean? What are the circumstances that might cause that to happen?
I'm sorry, I wouldn't have that answer. I would have to ask Ms. Gerard.
That's fine.
I will, and I'll have her report back to you.
Okay, thank you. That's something she can just maybe perhaps put in a memo or.
Okay,
It's not, I can guess, but I wanted her to explain it next time.
okay.
All right, very good. Any other comments or questions?
I just wanted to comment, thank you, let Mr. Gerard know that, thank you for allowing, that information, because I would have thought that something good came out of COVID, but obviously something else, they're turning a blind eye.
Right.
So thank you for sharing that information.
Sure, I'll let her know.
Could I just follow up on that?
Please.
Is that just empiric or conjecture? Is there any evidence that supports that people are turning the other way, or is it just the numbers are lower and we're taking a guess?
So I think it was more of because it's a collective speculated, do you know?
Okay,
And
right.
so I think that's what it was, but I can definitely ask her
Yeah, I think,
specifically on
I
that.
just think as a whole, we should be careful about taking speculation without evidence
Correct,
that's really happening.
Okay.
I think if they just took a best guess, that's fine, but it would be nice if there was some evidence to support what they're saying.
okay, thank you.
Yes, and Jed, that's exactly what I guess I'm asking her to do, to give us more meat on the bones if it's something we need to get ahead of, if that is the case. I mean, it makes sense that might be happening. If you're short-staffed, we're not going to be that excited about it, which is not good if it is happening, obviously.
Yeah.
Okay. All right, any other comments or questions? All right, very good. Thank you, Ms. Hayes.
Thank you.
Okay, that brings us to, I should ask for, well, there's no action, but Mr. Canotes, I should ask for public comment anyway. I have these pink cards that Jed gave me that tell me I probably should anytime I'm in doubt.
On each agenda item, at the end of the item, even if we don't take action, we should ask for public comment on that item.
Okay. I'm sorry, I misunderstood. I should or should not?
You should.
So is there any comment, public comment on the board activity reports? All right, hearing none, let's move to number 8. The Department of Consumer Affairs Director's update. Good morning.
Good morning. So good morning, President Armenta, Vice President Dr. Early, Executive Officer Khan, and members of the board. I'm Melissa Gear, Deputy Director for Board and Bureau Relations, and appreciate the opportunity to share the Department of Consumer Affairs update this morning. Before I get started, I would like to take a moment to congratulate Dr. Vasco Kidd on his recent appointment to the board.
Thank you.
You're welcome. And now I have several updates and reminders to share, starting with an update on DCA's DEI efforts. On May 12, 2023, DCA's DEI Steering Committee held its quarterly meeting in person and elected Chairperson Yafana Lamar, who currently serves as the department's tribal liaison and is the Chief of Legislation for the Contractor State Licensing Board, and Vice Chairperson Paul Sanchez, who is the Executive Officer of the Speech, Language Pathology, and Audiology Board. The committee discussed training, strategic planning, and DEI activities through the end of the calendar year. Providing employees access to DEI training is a priority to the DEI Steering Committee. In June, DCA began offering 3 DEI courses, which are available to all DCA employees. The courses are Understanding the Value of DEI in the Workplace, How to Decode Our Unconscious Bias, and Unleash the Power of Generational Differences. The response from employees to participate in these new DEI learning opportunities has been significant, with high registration and attendance numbers. The DEI Steering Committee is pleased to announce that outside consultant Dr. Bernard Gibson will provide in-person DEI training to DCA managers, supervisors, and leaders in October. In addition, Dr. Gibson will provide virtual training to board members on the morning of October 9th, 2023. Dr. Gibson has 20 years of corporate experience managing teams and training employees in business effectiveness. Dr. Gibson also has extensive teaching experience at various colleges, including serving as adjunct faculty since 2006 at University of Massachusetts for the School of Business and Professional Studies. Information on registering for this virtual event will be sent out soon. For those that cannot make the training portion will be recorded and be available at a later date. I look forward to updating you in the months ahead on the progress of the DEI Steering Committee. Also, to further the department's efforts to reach the Californians we serve, DCA will request boards and bureaus translate any press releases they issue into Spanish. California's top non-English language spoken is Spanish, and establishing a standard of translating releases into both English and Spanish will enhance the reach of information released. Boards and bureaus are also encouraged to evaluate any additional languages outside of Spanish that may serve their audiences. For additional information, please contact BBR. Next, as many of you may know, the changes to the Bagley-Keene Open Meeting Act that allowed board members to not have to notice their meeting location or meet in an ADA accessible location expired on July 1st. Therefore, as of July 1st, public meetings are subject to the traditional pre-COVID requirements for open meetings. DCA's boards and bureaus should be prepared to conduct public meetings compliant with the Bagley-Keene Open Meeting Act. This includes whether a meeting is held at a single centralized location or at multiple teleconference locations. Each physical meeting location will need to be identified in the public meeting notices and agendas. Board members must attend meetings in person at the noticed meeting locations. All noticed meeting locations, including locations where a single board member will be, must be ADA accessible, have an agenda posted, and be open to the public. The public will be permitted to attend meetings at any noticed meeting location. Additionally, members of the public need to be able to hear the meeting and participate in public comment from each location. DCA has a Bagley Keene Open Meeting Act guide available and has provided your executive officer with a list of available meeting locations throughout the state. Please reach out to Board and Bureau Relations with any questions or concerns. DCA is committed to helping the boards to make this a smooth transition. SB 544, which may allow for some meetings to be held without noticing the location of the board member, thus allowing remote virtual meetings, is still going through the legislative process. And the Department's Division of Legislative Affairs is working with stakeholders and providing updates to the boards and bureaus on the state's status of the bill. In addition, you may be aware that DCA has been working to implement AB 107 by Assemblymember Salas in 2021. And effective July 1st, DCA boards and bureaus, unless otherwise exempt, are required to grant temporary licensure to the spouse or domestic partner of an active duty military member stationed in California, if the spouse or domestic partner holds a license in another state with the same scope of practice as the profession in California for which they would like to practice. DCA's Office of Information Services and Communications Division has been working to support the implementation. All boards and bureaus were recently provided an outreach toolkit to help share the message of this new benefit to military spouses. DCA has also updated its military resources website to reflect new benefits as well. Next up is an update on two important projects that we're proud to share with you. The first being the Enlighten Enforcement Project, and the second, the Data Governance Project. The department is continuing work on its Enlighten Enforcement Project that is being piloted by the Dental Board of California. The Dental Board has walked through their intake complaint processing, citation, and investigation processes. One more walkthrough session will cover the discipline and probation processes. The goal is for staff to walk through the processes with subject matter experts so improvements and efficiencies can be found for the dental board that can be carried over to other boards too. The project also aims to learn best practices between boards and to standardize procedures for all boards and bureaus. The final benefit will also be a template for policies and procedures related to the enforcement process for all boards to utilize. DCA is continuing its efforts to improve its reports regarding licensing and enforcement activities. The director recently led multiple work group meetings beginning in late April through early July with staff from each board and bureau to update the data matrix reported in DCA's annual report. DCA's goal is to ensure consistency between the report data in the annual report, DCA's data portal, and board and bureau sunset reports. Future meetings are expected in August and ongoing to help build new reports or modify existing ones to provide these new metrics for next year's annual report. Additionally, DCA held a meeting on July 17th with all boards and bureaus to review guidance on how boards and bureaus can compile and report data to the department for inclusion in this year's upcoming annual report. Before I close, the following reminders may be helpful to you as you plan for the fall. First, board members who have been appointed and reappointed cannot begin their service or perform any official functions without first taking the oath of office. Unless otherwise provided, the oath may be taken before any officer authorized to administer oaths. Board members should contact their executive officer to arrange taking the oath of office. Board members will be required to complete the documents listed on the board member appointment checklist, or HR 5, and return them to the Office of Human Resources no less than 30 days after their appointment or reappointment. Duties cannot be assumed and appointments cannot be processed until documents are received and are accurately completed. Incomplete packets may delay per diem payments and travel reimbursements due to the member. Second, there are 2 DCA-wide mandatory trainings for 2023. This includes sexual harassment prevention training and information security awareness. All DCA employees and appointees, including board and advisory council members, will need to complete the sexual harassment prevention training this year. Board members must take the 2-hour supervisory training, and advisory council members must take the 1-hour non-supervisory training. These trainings are required every odd numbered year and is online, self-paced, in approximately 2 hours. Board members with an assigned DCA email, which would be dca.ca.gov, are required to complete the Information Security Awareness Fundamentals training. This training addresses everyone's role in protecting DCA data and information. The training is online and required every year. Both the sexual harassment prevention training and information security awareness training are available in the department's learning management system. If board members need assistance in accessing LMS and these trainings, please reach out to Board and Bureau Relations. Third, please keep in mind that all state travel arrangements must be made through DCA's authorized travel agency, Cal Travel Store, or Concur. When traveling by air and official state business, all board members and staff must use the most economical fares possible. If the flight is changed, there may be additional charges. Flight changes for personal convenience are not permitted or justified, and the traveler is responsible for any associated charges. Please contact BBR if you have any travel questions. Also, please note the Attorney General issued a press release adding 3 new states to California's restricted travel list with staggered effective dates in 2023-24 as follows. Wyoming, travel restricted effective July 14th. Missouri, travel restricted effective August 28th. And Nebraska, travel restricted effective October 1st. If you have any questions, please reach out to your executive officer for additional information. Lastly, board members must complete BMONT within 1 year of their appointment or reappointment. On October 10th, 2023, BMONT will be offered virtually. This will be the last meeting of the year. Members can register for this training via LMS. And now, what you've been waiting for. Thank you again for this opportunity. This concludes my updates, and I welcome any questions from the board.
Thank you. Please.
Yeah, so, great presentation, and a mouthful, right? A lot of information to cover, so thank you for that. I really appreciate, you did a really good job of that. So one of the things that I found very interesting was the Enlightening Project. If you can share maybe, and it doesn't have to be now, but maybe later on with the board, what that looks like and what the expected outcomes of that is, specifically if that may be something we may generalize to all DCA boards.
Yes.
So I'd really like to get a little bit more information about that and what those expected outcomes are.
Will do. I will get that to your executive officer to share.
Thank you.
Question, Hawkins here. Can you remind us again the purpose, the rationale, why those restrictions in those 3 states?
So those 3 states, additional 3 states, so as you know, there are several other states that have already been on the restricted list. They're adding those 3 states. I don't know the specific reasons from this recent press release, but it would be in line with why the previous states were restricted, which would be because they're not aligned with our laws related to some of our LGBTQ or other civil human rights related issues that are important to California.
Thank you.
Any other comments?
Yeah, thank you for that report. That's very informative. I wanted to ask, is the DEI training mandatory or required for all board or DCA staff?
So currently, DCA is not mandating board members and our DCA employees to take the DEI training. However, it is strongly encouraged that DCA employees take it, and if board members have an opportunity to take it as well.
Do you have any sense of what percentage of the employees or staff have gone through this training, or is that something that's being measured, or?
That is being measured as we just have started our DEI efforts. The steering committee was just established this year, and these new trainings were brought to all of DCA employees in June. We're still working on those metrics, but what we have seen is there's been a strong interest between employees and board staff, and many of our boards and staff have been taking the training since they've been offered, and we will have additional trainings offered throughout the rest of this year and into next year as well.
Great, thank you.
I have a follow-up question to that. As part of the DEI training, is that above and beyond implicit bias training, or?
Yes.
It is, okay.
I have a question about the dental board pilot project. When is that expected to be completed so that there is some more intelligence on what might move forward?
I'll have to double check for sure on the actual date, but I believe they are planning to complete that by the end of the year.
Okay.
But I'll get back to you and provide Rosanna that information as well.
Is the intent there to create a model that will be mandatory for all the other boards, or is it gonna be continued testing and how it fits at each board, or what is the thinking, do you know?
I believe the understanding and thinking with that is that this will be the model, taking the best practices from the dental board and then being able to apply those best practices to all of the other boards, of course, making the appropriate modifications.
So it won't be advisory, it'll be something that we are expected to do.
I don't want to say expected just because I'm not 100% sure on that.
Good answer.
But it definitely would be a resource and may be strongly encouraged.
I understand, okay, thank you.
Just a follow-up question, and I like the way you answered the lawyer, because that's really important. So great job there. Is there going to be any input into that process? Let's say that it does become mandated. Will the PA board and other DCA boards have input into the process before it kind of rolls out across the DCA landscape?
Again, I would like to say that is correct, but we'll need to get back to you on that.
Okay, appreciate that. Thank you.
Thank you. Any other comments or questions? Very good. Any public comment or question? Very good. Thank you so much.
Thank you.
Okay, that moves us to item number 9, our budget analysis, budget update.
And I will be reading that for the budget update for the DCA budget analysis. But first, I'd like to say thank you to Mrs. Gare for that excellent report. I appreciate that. I will be reading, but good morning. We are going to start with the budget memo. This will give you a general overview of the board's budget as well as the percentages of the budget used and counted towards expenditure. In 2022-23, the board has a budget of $3,122,000. The board projected to use 36.76% of its expenditure on personal services, which includes salaries and benefits. 38.51% of the operating expense and equipment which includes contracts, purchases, and travel. Finally, 24.53% for enforcement, which is for Office of Administration hearing and the Attorney General. The board is estimated to have 0.19% in reversion. On the second page, we have a fund condition. We have 21-22 actual beginning balance of about $4.8 million with prior year's adjustment of $197,000. That gives us an estimated or an adjusted beginning balance of about $5 million. We have an overall revenue of about $2.5 million. Transfer to general fund, AB 84 of negative $88,000. And total expenditure of about $3 million. That has a fund balance of $4.5 million, which is about 16.6 months in reserve. Next is the current year 22-23, second column, which includes the fiscal month 11 projections included. 22-23, beginning balance of about $4.5 million. We have an estimated revenue of about $2.8 million and estimated total expenditure of about $3.2 million. That gives us a fund balance of about $4 million, which is about 14.9 months in reserve. the budget year is based on the governor's budget, and budget year +1 is based on realized. We have no immediate concerns for this fund. That concludes my report for the budget team.
Thank you, Vice President Early. Any comments from the board? Ms. Halvo?
Just an editing question. This is what people do, is edit. I think it's supposed to be personnel services, not personal. One sounds a little off color, and the other would be the correct word.
Yes. Thank you. I will let them know to make that correction.
Wait, you know better.
Thank you. I appreciate that. Thank you.
That's an excellent, you know that, because that's one of those things you just read over and you think personnel in your mind, but excellent point. All right.
On the record, yeah. So we'll have them correct their notes to me. Thank you, I appreciate that.
All right, any other comments or questions? Any public comment? Very good. Thank you, Vice President Early. That brings us to item number 10, which is discussion regarding professional title change from physician assistant to physician associate. Council notes, you're on. Can you, you're still, can hear us and have mic?
Good morning. Good morning, Mr. President, members. I know some of you can see me and some of you can't. Can everyone hear me okay?
Yes.
Yes.
Excellent, excellent. Okay, so I'm taking this item. I had a lot of good conversations with your staff on this issue, so thank you very much to Ms. Khan. So obviously we're addressing the movement in the PA profession to change the title of the profession from physician assistant to physician associate. So in general, this is what we call a title protection. In terms of a general concept, really all of the healing arts and many other boards have provisions that reserve the use of the title of the profession only for individuals licensed under the profession. So when looking back to the establishment of the PA profession, the Medical Practice Act provides that a person who advertises as a doctor or physician or represents that they're a physician by using the term doctor or physician and or other terms indicating or implying that they are a physician is under the statute, they're guilty of a misdemeanor, but obviously they're violating this provision of the law. So the Physician Assistant Practice Act was adopted in 1970. But just sort of an interesting way to think of this is that it created a title protection for the term physician assistant, which is located in Business and Professions Code section 3503. But prior to that, if we went back, say, to the 1950s, before the establishment of the profession, if an individual was using the term physician assistant, that would have violated the Medical Practice Act provision. What enables physician assistants to use that title is, of course, the later enacted statute that reserves the title for the profession in the Physician Assistant Practice Act. So ultimately, there is no, in the Physician Assistant Practice Act, there is no title protection for the term physician associate. In order to change the title of the profession in California, the legislature would need to adopt a statute doing so. In the absence of that, use of the term physician associate would violate Business and Professions Code section 2054 and could subject, if done so by a physician assistant, could subject them to discipline. we can certainly, from there, we can certainly have a discussion about that. It ultimately would be a matter, though, for the legislature to address.
Reviewing remotely, of course, and do you mind sharing why that is, or would you rather?
Not at all.
Okay.
Not at all. Not at all. I woke up yesterday morning with a little sniffle, and under an abundance of caution, I took a COVID test and ended up taking 2 tests, and they were both positive. So I apologize that I'm not present in person, but I'm also very thankful to the board, Ms. Khan, for we were here yesterday testing out the system, and very grateful that I'm able to appear by video.
Okay, great. Thank you, sir. So if I understand you, that it appears that any change in name would originate with the legislature in terms of a statutory change.
That is correct.
Okay, very good. Any comments or questions? Any public comment or question?
Mr. President, I will note that we received some written comment, and that will be entered into the record, and I think that will be available. Ms. Khan has some copies, so that will be available for you after the item.
Okay, so these will be handouts to the board members for their review.
If they would like one.
Okay.
Ms. Khan has copies with her.
Excellent, thank you.
I would like one.
Okay, I would too.
Yep, I would like one too.
Me as well.
I think we just hand them out to all the board members.
Yes,
Okay,
I will.
all right, very good.
Very good.
Good morning, sir.
Good morning. I'm PA Scott Martin. I'm the president of CAPA, recently renamed the California Academy of Physician Associates. Thank you for having us for this discussion today. As always, we look forward to collaborating with you and your staff on this issue. So just by way of background, here in California, with SB 697 and in other states across the country, laws have recently been changed to permit physicians and PAs more flexibility on how they collaborate with one another to provide high-quality care to their patients. Under SB 697, the degree to which a PA is permitted to exercise clinical discretion in patient care under the supervision of a physician is memorialized on a PA by PA basis in practice agreements. That will and should differ based upon the qualifications of the PA, the needs of the patients, and the demands of the clinical setting. Some, maybe most, practice agreements in California permit PAs under the supervision of physicians to exercise some degree of clinical judgment. And that's the problem with describing to patients what we do exclusively by using the word assistant. Many people understand the word assistant as meaning someone who merely carries out a specific order of a superior. For example, somebody that picks up dry cleaning, makes appointments, or picks up coffee. It certainly is possible that the PA's role in patient care under the practice agreement could accurately be similar to what most people think the role of a physician assistant is. However, that may not be true at all. So here's the key point. If a PA through the practice agreement is permitted to exercise some clinical judgment under the supervision of a physician, then exclusively using the word assistant to describe our role to a patient regarding their care is to knowingly mislead the patient about the degree to which we as PAs may be individually accountable to this very board if things go wrong. If a patient wrongly believes that the assistant is only acting at the specific discretion of a physician, their complaint will be about the physician, not the PA. One of our leading medical malpractice insurers that supports the use of the phrase has written, and I'm quoting, "The change addresses a common misperception that PAs merely assist physicians. Consider when a physician uses descriptions to patients that might more accurately describe their role in the patient's care beyond simply words that appear on their license. For example, primary care physician, chief surgeon, chief resident, these are just 3 examples. But these physicians are not trying to create a new license. The medical board would not discipline these physicians for using these titles unless the use of these titles misleads patients. So we respectfully submit to you that this is the exact same should be true here. If a PA uses the word associate or any other phrase that intentionally implies that they are able, under the practice agreement, to do things that are not legally permitted to do, this board should vigorously pursue discipline against that PA. Likewise, if a PA is using words that more accurately inform patients of their role in patient care, that's a good thing, especially for a board like this one whose primary mission is public protection. So 3 other practical considerations just to round out our comments. First, we at CAPA have uniformly told inquiring PAs that they should never, ever refer to their license as anything other than a physician assistant. Second, we have uniformly told inquiring PAs that they must always get permission from their employer to using any wording other than assistant to describe to their patients their role in patient care. This is important to us because it means that when a PA uses the word associate, it will be because both parties to a practice agreement agree that the use of the word more accurately describes the PA's role. And lastly, we at CAPA currently have no plans to seek legislation on this at this time. And the reason is simple. We do not know how many practice agreements are better described by the use of the word assistant, such that uniformly switching to associate poses little to no risk of misleading patients. So you can guess what we would think would happen. Clearly, we changed our name to the California Academy of Physician Associates. So to us, it makes sense to see how and to what extent the actual parties of the practice agreements, physicians, employers, PAs, who provide care to patients, either embrace or reject the use of the phrase associate, and under what circumstances they embrace or reject it before we generally seek binding government legislation. So in conclusion, we have respectfully provided for you the consideration of our thoughts regarding the applicable laws. Here with me today, I have a CAPA staff member and a couple board members to answer any questions that you may have. And then finally, on a separate note, thank you very much again for the recent draft regulations published, which we support enthusiastically and will not be submitting any comment for. So again, thank you so much, and my colleagues and I are pleased to answer any questions that you may have.
Thank you, sir. Any comments or questions from board members?
Mr. President, this is public, forgive me for interrupting, but this is public comment. If there are no other public, we can't during this period engage in a discussion and discuss public comments. So at this point, we can ask for additional, if anyone else has public comment, and if not, we should move to the next agenda item.
Very good. I stand corrected. I think you are exactly right. Very good, sir. Thank you.
Thank you so much. And also, there should be a memo that legal counsel from CAPA has also sent over that you all should be privy to. So please take a look at that and at your own time and leisure. Thank you.
Very good. And I can see we have more public comment.
Yes, it's actually more a question to the PA board. So we understand, by the way, sorry, I didn't introduce myself. Teresa Chen, Executive Director for the California Academy of Physician Associates. So my question, excuse me, is to the PA board. We understand right now, currently on the website, the PA board website has a position statement about, I guess, your position or stance on the new title, Physician Associate. So my question follows in that this profession has been called several things over history. It's been known as physician extenders, mid-level providers, even recently advanced practice providers. As PA Kidd, his title is Director of APPs. And a position statement has never been posted about any of these titles. So I think my question is really, why the PA board has decided to take a stance on this latest title. So it's really more a question, not a comment.
I think
Again,
Mr. Canoes,
legal counsel.
I'm sorry, go ahead, Mr. Canoes.
We cannot, this is public comment. We cannot answer questions or have discussions about public comment. So to the member of the public, I would suggest that you address that question at a later date after the meeting with the executive director, Ms. Khan.
Okay, And then just feedback mostly to the staff. We appreciate that the PA Board's legal counsel is able to, I guess, meet virtually. If you wouldn't mind permitting the public to also be able to do that, we know that lots of other individuals, other PAs, that may want to come and participate in person, but can't always. If you can make that availability, if not virtually, at least telephonically, that would be nice. Certainly, our legal counsel would have appreciated being able to do that. Thank you.
Thank you so much, Ms. Chen.
Mr. President, could I ask a question real quick, just to
Certainly.
clarify with Mr. Knotes?
Yeah.
So we're under agenda item 10, which specifically is discussion regarding this issue. So I'm confused why the board is not allowed to discuss it when public comment is made about it. I don't understand that process.
Oh, Michael, your audio dropped.
My apologies.
There you go.
A discussion item is for discussion by board members, and the president asked for discussion, and I don't think there was any. But when we move to the public comment portion, we're allowing the public under the Open Meetings Act to provide public comment, which they're entitled to, but we can't discuss or answer questions or engage in a discussion at that time.
So,
Well,
Mr.
I'm sorry, Charles, I didn't mean to cut you off. I don't feel like we had any discussion about this before public comment was made, so maybe we went out of order. I would appreciate the opportunity to be able to discuss this amongst the board. If that has to be in
Yeah,
another meeting.
Mr. President, you can open the item for discussion. I'm quite sure you did ask for board member discussion, and there was none.
All right. well,
But you can open it back up for board discussion if you'd like, but we should not be addressing the public comments that were made.
Right, and I think that is simply because the practicality that since we act as a unit, there has to be a policy issued before we can make policy on that, I guess is the thinking. Is that correct?
Board has no ability to make policy here.
Correct.
And,
Right.
again, in terms of the Open Meetings Act, it's inappropriate for the board to engage in a discussion with members of the public on public comment. Public comment is provided for the board, and the response should always be, thank you for your comment.
Okay. Jed, I will open it up for
I
discussion.
just wanted to make sure I understood the answer to my question. Can I clarify?
Sure, go ahead. Well, let's see what Dr. Alexander has, then we'll open it up for public discussion. I'm sorry, board comment, and you can go ahead.
Thank you, Mr. President. I was really tuning into what Jed is saying.
Okay.
Otherwise, the item should be presentation instead of discussing, if we're not allowed to discuss.
Okay, so you're on the same page. So let's go ahead and Jed will open it for board discussion. So go ahead.
Okay, so if I understood, Mr. Knotes, your presentation basically said, if I understood correctly, that this is a legislative issue, the board can't take a position on this because the legislation, the law is clear that this isn't reside within our domain to make policy decisions about or anything like that. It's a legislative issue. Is that correct?
That's correct. In order to change the title, the profession, the legislature would need to carry a bill that changed those terms in the Physician Assistant Practice Act to Physician Associate Practice Act, change the title protection in the Practice Act, it's section 3503 to the title protection for physician assistant to physician associate in order to accomplish that change.
So regardless of any conversation or discussion that we might have today about what we want to do about the title of PAs, we would have no binding effect. There's nothing we could actually do about it because it's a legislative issue. Is that correct?
Correct. There's no action the board could take to implement this, but it's certainly appropriate. And I was sort of surprised when the president asked for board comments that there weren't any. But you can certainly discuss whether you think this is a good idea, your views on it. That is all within the board's discretion to do in terms of the discussion item.
Okay, thank you for clarifying. I think I understand a little bit better now. And since if it's all right with you, Mr. President, since I already have the microphone.
Please, go.
I'll talk more. Sorry.
I don't want to ever be accused of refraining your comments, Jeff. Please go ahead.
So I would just share my opinion that I think this is a good thing. I think we need to accurately represent to patients what PAs do, and, you know, the word assistant has frequently thrown patients off in my nearly 25 years of seeing patients. I can't count the number of times I've had conversations explaining, you know, the scope of my practice and what I do, and a word that more clearly, you know, demonstrates that is good. I think that the board should be supportive of that as much as we can, even though I understand that that's, you know, under the jurisdiction of the legislature to make that change. I certainly would be supportive of it and think it'd be a good thing both for PAs and especially for the public to understand what PAs do so that they have more confidence in people that are providing their health care.
This is Dan. I would underscore everything that Jed just said as well. And I think physician assistant does not speak to the evolving nature of PA practice in the 21st century. We're starting to see modernization of PA practice laws across the country. There's 8 states that now allow PAs to practice without physician supervision. It would be hard to be able to say that you're a physician assistant and then practicing without physician supervision. So not that we have that in this state, but I think as we look at the future and what that holds, it is important that we do have a professional title that is reflective of the work that we do. And I'll just remind the board here, there is no other practitioner that does the work of a PA that has assistant in their professional title. So it is time for a change. I think we have a well-established occupational identity of 5 decades. Now it's time for us to really look at how we could evolve the professional title. And we will need, hopefully at some point, some legislative process. There doesn't appear to be any flexibility within the Medical Practice Act to allow us to do that, unless we have some type of legislation. So I would encourage folks and other like-minded individuals and constituent organizations to think about ways that we can partner and work together on reflecting the role of the PA by changing the professional title to ensure that patients fully understand the work that we do and they know how to refer to us the way that we think is more appropriate.
I would just like to include that I would support all of that from my counterparts. So I would, and I think overall we want that, but there's just a legislative process that we need to go through to get there. Hopefully CAPA, well, hopefully we all can move in that direction, but also just a historical note, Yale still calls themselves or graduates physician associates. So back from 1971. So, and we've also been called that historically in the past. So I think we're just coming back to our roots. So hopefully we can go ahead and move forward with that. So thank you.
I think Dr. Hawkins was ahead of you, Ms. Snow, but.
Sorry.
It's not that important, don't worry about it. Thank you. Dr. Randy Hawkins, Medical Board. I really support the comments that have been made thus far. Words do matter. Thank you.
All right, Ms. Snow, please.
Just to go forward with this, would our next step, if we decided to pursue this, to try to approach a possible legislator to see if they would support this change?
I'm not sure, Mr. Knoz can comment, but I'm not sure that that would originate with the board. I think that
Okay.
needs to originate from other sources to get a sponsor, either an assembly person or a senator to propose a bill, I think is what needs to happen. I don't know that we can do that. I do have a comment, and Ms. Snow and I are the only non-PAs on this board.
Me too.
And
Dr. Alexander.
Dr. Alexander, that's right, I'm sorry. Well, and Dr. Hawkins, of course, who is advisory. And interestingly enough, my practice, I do see a lot of, because it's a workers' compensation, which deals a lot with, in fact, Arrowhead. A lot of our patients, or clients, which are patients, especially the farm laborers, I can tell, and this is not a discussion of confusion between associate and assistant, because that's not even a word that what they see at this point. They often confuse PAs with MDs, particularly the Spanish speakers. When they come to my office, I said, well, Dr. Kidd said so-and-so and so-and-so, and I said, well, wait a minute, who's Dr. Kidd? He's not an orthopedic surgeon. That is common, and I've shared this, I think, with some of our members here, and I think a conversation with Jed was absolutely shocked that that happens. But you weren't?
No.
Oh, I thought you were.
That was sarcasm, sorry.
Oh,
it didn't come out.
okay.
Just a little satire.
I see it more often than not, particularly in the Spanish speakers. So I don't know how that fits into this matrix, but it's just an anecdotal observation I wanted to make, that there can be confusion, and I don't know how you go about crafting a bill, but I guess we'll wait and see if it's promoted at some point. Okay, any other board comments?
Perhaps we can reach out to Mayor Karen Bass, who is a physician assistant. So-
Oh, she is?
Yep.
Yes, she is.
Okay, I did not know that.
So, maybe we can get-
Another, in order to interact with public, could we put it on a further agenda item for next time?
We certainly could
I'm
include,
just wondering if that.
I think any board member can suggest an agenda item, and I don't think that's a problem.
I'm suggesting it.
May I ask a question, Mr. Canales? Are we allowed to engage the public regarding a question that we may have as a board, or is that off limits?
I would not do that in terms of public comment on an item, no. Public comment is just comments being made to the board that the board can consider at a later time.
Thank you for the clarification.
Okay.
Mr. President, I'm going to defer to my colleague to the left, Dr. Hawkins, in terms of the medical board's perception of this title change. If there's some way you can gauge or get some feedback on the medical profession, because I could see where physician associate can be misconstrued too as another physician, as opposed to the title that currently exists. Just out of confusion, I mean, just as a public member, just your perception on that.
Well, thank you for that question. And my response was my personal one. Although I'm a physician in practice and actually employ a physician assistant, I've done it for at least 20 years, and represent their contribution to the practice. And it is collaborative. And so to me, it's a no-brainer. I am not representing the medical board when I today mention my support of that. We have actually, I'm just reluctant to say what might happen, but I feel very strongly about my ability to comment. I would also share some of the frustrations. One of the frustrations we have, and this is off topic but related to something that was just stated, we are also told that we can't respond to the public. It's very frustrating at times when they have a question or have a comment, and there are reasons why we say we can't, but it imposes a distance, a barrier to some of the constructive dialogue can occur, and that's just a comment related to what's happening now.
Well, Dr. Hawkins, I think if you have a comment towards me or a question towards me that would be the same comment that you would make to anything that you've heard, it's okay. So go ahead, or not to me or to any board member.
I'm speaking about responding to the public.
Well, if they pose a hypothetical question, I would like to hear
I see.
your response.
Okay.
I would, so please go ahead.
I was just making a comment, but if you're talking about Dr. Anderson's inquiry, I suspect there would be support from the medical board about the title change, because many of them are in a discussion. I've been on the board for about 7 years. We've had a deliberative process. There's a good amount of engagement, dialogue, in and out of the meeting without violating the Public Practice Act, the limitations we have on Keene. So I don't have a problem making comments to the members of the board, because we are allowed to do that regularly in our meetings, the medical board, just as we are here. My only comment really is that it is frustrating at times not to be able to respond to the public when they make a legitimate current concern or question. That's my only statement. But we're limited, as our attorney has told us today, that we're not. We're told there are good reasons for that, and sometimes we recognize that some individuals in the public really don't want to have a constructive dialogue. They just want to get on their soapbox and yell and scream and this and that. But that doesn't represent everybody.
No,
So,
what was the question that you think was pending that you would like to respond to?
There's no question. I just wanted to make a comment about my frustrations on the medical board, which I'm feeling in the room about not being able to respond to the public when they make a comment that's appropriate. For example, it'd be difficult, I think, to anticipate all the questions that might occur in board discussion initially until you've heard some of the comments from the public.
Okay,
Mr. President?
That's all I'm saying.
yeah. Oh, thank you.
I didn't want to cut off Dr. Hawkins, but he's, okay. I do have a couple of additional comments.
Go ahead, please.
The first one is, if we talk about titles, right? So in my career as a PA, I've been referred to as a mid-level provider, an advanced practice clinician, an advanced practice practitioner, and probably some other names that are inappropriate for public conversation. So I think what's important here when we're talking about the formal title of the profession and how a provider is representing themselves to a patient is really where the PA Practice Act comes into play. How I am referring or referred to by my employer or others in administratively and that sort of thing, I think is less part of the purview of the PA Practice Act. This is more about how do we identify ourselves to our patients in terms of their understanding of what we do and their perception. So I think if someone were to posit a question about why the PA board is paying attention to this when maybe they haven't paid attention to some other titles that may have been used informally, that's probably why. Although I'm not an attorney, I would say that that's probably the reason for that. And I forgot what other comment I had now, so I'm sure it'll come to me.
I think the answer to that question is why is it on here is because a board member requested it because, I can't remember who, because it's something we see on the horizon. It's something we should discuss to get ahead of it.
No, I wasn't questioning why this is an agenda item.
Oh, okay.
But more why, if PAs have been referred to by many different titles over the years, why is calling a PA a physician associate something that we are worried about in terms of the PA Practice Act, which Mr. Knotz talked about in the beginning? This is the reason, because when you are referring to yourself formally with this title to a patient, that is encroaching on the Medical Practice Act and the title that you're authorized to use, and being clear that you're not holding yourself out as a physician, and that you are only trying to accurately portray your role in the medical system to a patient. So I think that, just to clarify why maybe the PA board never even had a conversation about any of those other titles, is because they're mostly administrative. And the other comment I had, remembered now, Dr. Hawkins, is one of the things that I think has come up in relation to the title change for PAs quite a bit is the idea of scope creep, that PAs are trying to broaden their scope of practice. And I would just say that from my perspective, the change of the name has nothing to do with scope. It has only to do with accurate representation of our role within the healthcare system to the patient, who is the person who really needs to understand who we are and what we do.
Yeah, and if I could
Understood, and that's my interpretation.
Yeah, if I could just kind of dovetail on that as well. Just to your first comment, when you look at advanced practice providers, mid-level providers, advanced practice clinician, those are bucketed terms for APRNs and PAs, right? So it's all inclusive in terms of how providers are described nowadays. And to Jed's point, I think it's really important to kind of think about, how we represent ourselves to our patients and what the PA profession is hoping to achieve. We're not trying to change our scope. We're just trying to modernize the PA practice laws within states to allow us to do what we've always done best, but make sure that we're referring to ourselves appropriately based on our skill set. So the question that I have that I'm going to pose to the board, and maybe someone from the public may comment, maybe that's a workaround, would be what percentage of PAs in California currently refer to themselves as physician associate? If I'm not mistaken, there was a survey initiated by a constituent organization currently present in the room, and so I'd like to know what percentage of PAs currently does the board know what percentage of PAs currently referring themselves as physician associates?
That's a good question. But I don't know if I have the answer. But what gives me thought is there's a so-called working title and a job title.
Yep.
With most employers, right? And maybe the employer is calling the physician assistant, physician associate as a working title, but the job title in terms of being hired actually is physician assistant. So I don't know if organizations are doing that, which, create that title for that organization, but the job title, or the job title is actually physician assistant.
Yeah, so there are some employers that are advertising for PAs, referring to them as physician associates.
Okay.
And so we have seen that in some of the search engines, like Indeed. They refer to them as advanced practice provider, and then kind of delineate, are you looking for a PA or an NP or another advanced practice provider, as folks would say. So we are starting to see that, within, our internet searches for PA jobs. But interesting, again, because I see a lot of PA colleagues that are now using physician associate within their social media platforms. So as we've learned, there's not the flexibility within the Medical Practice Act that allows us to do that until we can get a legislative fix. But it would be interesting, as the board would need to respond to this, I think, not only, today, but now in the future, as more and more PAs begin to pivot from physician assistant to physician associate, and how we need to respond to that more globally, given the number of PAs that are now representing themselves as physician associate, which I'm still looking for the statistic on that.
I would just like to include that it's really, after all these conversations, that it's imperative that we come to one name.
Yeah.
Whether it be physician assistant or a physician associate, legislatively, we need, as a body, to come together as one, under one name. I, talking to the board, would love to see CAPA legislatively take this on, because I believe, even as I remember as a new PA, the only way that I knew anything was through CAPA's newsletters and things that my head was down, I was doing my job, but when CAPA sent something, that was the time when I took a moment to reflect, sit down, read, and then I came up with things that I was supposed to know as a new PA. So just speaking with us, that I would love to see that. And then also maybe AAPA, the organization that created the name change in May of 2020, may be able to work with our legislative body so that they can go ahead and legislatively do this process accurately, so that all PAs are known as one name, whether that be physician assistant or physician associate. But I do agree that we need to move forward with the name change, but that's my own personal opinion.
One comment on the number question. Because of what Mr. Knoth said about our current PA Practice Act, actually, it's not legal to represent yourself as a physician associate to a patient right now. So as a licensed member who knows this, I don't do that. But that's really going to skew that data, right, that you're getting, because there may be a large number of PAs in practice who would love to refer themselves by that title, but are currently legally prohibited by the law from doing that in California.
No, I would agree with you, and I do the same thing as well. I refer to myself as a physician assistant. But again, getting back to what the landscape is in the state, how many PAs are actually referring to themselves as physician associate, who may not be fully aware that there is no flexibility within the Medical Practice Act to do that.
Exactly.
And so there may need to be education disseminated from the board to those PAs, so they know that they have to work within the confines of the Medical Practice Act.
So I have a process question for Mr. Knoth. I'm unaware of if the board has any ability, or is there some law that prevents us from, as a board, asking any member of the legislature to consider sponsoring a bill? Do we have the ability to do that, or is that, we can't do that? Fill us in.
Yeah, you would. So generally that would be done, it would be done via a board legislative proposal. The board has the ability to begin and offer a legislative proposal, and then basically usually that is done by motion. We would put together an agenda item with the direction of the board in terms of drafting the legislation. The board would approve the drafted legislation and then direct the executive officer to search for an author for the bill. If we were going to do that, we would need to put this back on the agenda as a legislative proposal. And actually, although the legislature is currently in session, legislative proposals are generally done in the fall. And the process for all state entities and departments really does begin right when the legislative session ends to introduce items for the next session. You're an independent board, but the entire state bureaucracy proposes legislative proposals in the fall that eventually go through the governor's office. The governor can consider in terms of the budgetary process, but that's probably a longer answer than you need. But we would be putting this on, if the board is interested in sponsoring a legislative proposal, we would be putting this on the agenda for the next meeting and preparing that for you.
Okay, I think that probably fits in what you were getting after. I'd comment that it's interesting that I think the CAPA presentation, the first one had for the gentleman, is indicating that they have no intention of sponsoring legislation, which seems odd to me. Why should our board be moving to propose legislation if the main, I guess, proponent of it is reluctant to? I have certainly no objection if anybody wants to see it as a board item for a future meeting to look at. And I think obviously if there is legislation, then we would invite more robust debate, including statistical analysis of things that are out there.
Yeah, Mr. President, I agree with you. I think, the health professions have evolved so much. And when you look at physicians, there's been many disciplines in the physician world that have come on board in the last 10 to 15 years. I mean, sports medicine wasn't sports medicine 20 years ago. Nurse practitioners weren't nurse practitioners 20 years ago. And so I think, to move into this modern era of health profession naming, physician associate certainly deserves some credence in terms of name change and profession, because the profession really has evolved. It certainly would take the mystique off for the public, who, as I heard say, most physician assistants, when they walk in the exam room, you don't know if it's the physician assistant or the physician. And certainly the associate title would be, in my opinion, the most appropriate for the profession. So personally, I'm high on that and I'm supportive of that. What we can do, I don't know, but certainly would support, so.
Yeah, I think it'd be interesting to see medical board's actual response. I know we have Dr. Hawkins' individual comment here, but I wonder what they would do as a board. It'd be interesting to see.
One thing you can do is, and when I give a report, indicate the next board meeting is, you can go online and in the area of personal comments, items not on the agenda, someone from the board can actually speak to that and raise the question.
Very good, thank you.
And Mr. President, just to add, if the board does propose a legislative proposal and that makes it into a bill, then I think the medical board would certainly be taking a position on that, looking at that and discussing it. So really the legislative process is the arena where this change needs to be made and where the public would more effectively engage with the legislature and the governor in terms of the decision makers here.
Understood.
So although the board may not respond to that inquiry or comment, it'll be put in the room and people will be thinking about it. So
What was the inquiry?
there's a portion, as is here, on the meetings where there can be public comment items not on the agenda.
Oh.
So there'd be an opportunity for someone from this board or someone from the public to say, there's been discussion about this title change, physician associate from physician assistant, and blah, 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 blah. And so there's an opportunity to just mention that.
And when is the next medical board meeting and location?
I'll give it in my report, but it's August 24th and 25th.
Yeah, I think if I understand you correctly, Michael, is specific questions about data, it's nearly impossible for us as a board to answer that question specifically in this format because we have not made policy on it, correct?
Well, I mean, I'm not sure what data you're referring to, but we can ask Ms. Khan, but I don't think the board has any data on the use of the term physician associate.
Okay,
So if the board doesn't have any data, then I'll withdraw my question.
okay.
Because that's what I was specifically looking for, if we had any specific data on the number of PAs that are currently referring to themselves as physician associate. If that data is non-existent, then we'll wait till that data is present, and then we'll discuss it.
Okay, all right.
Do we need to do more research on that? Is it, there is no data, or we just haven't done work to
I
find
think,
the data?
I think there is data in the space, we just have to abstract the data, and the question is whether we should be initiating or have other organizations have initiated or fielded surveys, and I think there has been some surveys, but whether or not we as a board can consider that data based on where it comes from, I'm not sure we can, so I
Well,
think.
I think if they have data that they want to present in a public comment or in response to any legislation, they certainly can do that.
That would be great.
Yeah.
If there's data that's out there that someone could present that I think would be data based on, obviously survey data has its own challenges, which I'm not gonna go into
Sure,
here, but
sure.
we can certainly, if there's some preliminary data, it'd be great to, to hear that.
Well, I'd like to add this discussion back on the agenda until we get it resolved.
I think Ms. Snow already did.
Oh, great, thank you.
Yep.
I second. I'd like to second that.
All right, so the executive officer can make a note that this will be an agenda item again. Okay, any further board comment?
I might just add that the title of the comment might be discussion regarding legislative proposal regarding the name change of the profession, so that we can discuss that portion of it. If that's okay with you, Ms. Snow? Okay.
Then I'll just make one more comment. Perhaps CAPA may want to reconsider their position on whether they would support legislation for a name change.
Mr. President, can
Yes.
we do more public comment on this now that we've had more
That
discussion?
was my intention.
Oh, okay.
Yeah. So, okay, is there any more board comment? Okay, let me revert then to public comment.
Hello, everyone. Sorry to rain on the parade. My name is Lucas Evanson. I am the Associate Director of Strategic Engagement for the California Medical Association. Thank you for providing the second opportunity to provide public comment. CMA opposes the movement to change physician assistant's professional title to physician associate because it obfuscates the role of physician assistants in a patient's healthcare team. The current title of physician assistant is clear and understandable to healthcare consumers. A physician assistant is a practitioner who assists supervising physicians in providing care and treatment, but is clearly not a physician. This clarity does not exist in the physician associate title. A physician associate may represent many healthcare professions, but importantly, it can represent a physician, as a physician may refer to their physician colleagues as associates. The effort to change the title of physician assistants to rebrand their profession will only serve to confuse patients, which can lead to unintended and potentially dangerous consequences. For these reasons, we recommend that the board continue to advise physician assistants against using the alternative title and not seek any further changes. Thank you.
Thank you, sir. Any other public comment?
Wow, I don't even know where to begin.
At the
I
beginning.
guess my first comment, public comment, will be, I suppose, just in response to CMA's stance. The comment about how the new title would only confuse patients. CAPA obviously vociferously disagrees because physician assistants currently already confuse patients. Patients don't actually know what PAs do. And I would argue that's not necessarily the patient's fault. This profession has always traditionally had a poor public awareness problem. You know, it's just what it is. It is our firm belief that this new title would actually clarify the role that PAs do with physicians. So, first comment. And then the second comment, I wanted to also make some clarification. When CAPA had testified that we would not be pursuing legislation, we did not mean indefinitely. We simply do not wish to pursue legislation right now. And the initial intent of my first coming to make my second public comment was, CAPA would like to respectfully request that the PA board consider establishing either a subcommittee or a steering committee to actually monitor the use of both physician assistant and physician associate at the ground level, where it is actually being used by employers, by the PAs themselves, and how that interacts with not only in the practice setting, but between PAs and the patients themselves. We don't know how a patient might react when they hear physician associate. We definitely know how they would react when they hear physician assistant, because we've all seen it. So we respectfully ask that we permit the use of the title with the PA board monitoring and collecting data so that we can determine what really truly is going to be a better title for this profession. Obviously, as our president has mentioned, we already have a prediction. We believe that this new title is absolutely better for the profession. It seems like the PA board in general obviously agrees. So I wanted to make that clarification. It's not that we have no intention. We would like more data. We don't have enough data right now to even be able to say, yeah, this is, it's very different to say, yeah, we're just gonna call ourselves something different. For us, it is very intentional, and we hope to see that change at the ground level. We just don't know yet. Third comment, I wanted to answer PA Kids' question about the use of the new title right now. We actually did do some data collecting. We surveyed all of our members, anyone who is licensed. We even surveyed PA students, et cetera. And the general response is 20%, obviously this would be a random sampling, 20% of California PAs are using the new title at least occasionally. So occasionally they might be saying PA, they might be saying physician assistant, occasionally they might be using physician associate. So 20%, just to answer your question. I also want to mention, since we're talking about the use of the new title, in Spanish, physician associates are known as, and I apologize, I'm going to butcher this, asociado médico. Literally translated, it's physician associate. Why would we want it to be different in Spanish and English? So let's think about that for a second. And finally, I know we're hearing a lot about the legality of the use. I'm sorry, it's unfortunate that the board of directors did not get a chance to read CAPA's legal memo from our legal counsel in advance of this meeting, but we actually cover some of those topics. So with all due respect to the PA board's legal counsel, yes, that is one interpretation, one legal interpretation. Our legal counsel documents very thoroughly in our memo his interpretation of California law and the use of the new title. So I would also recommend perhaps CAPA at another PA board meeting or another time, whether in public or just between CAPA and the PA board, we can certainly discuss and answer more questions after you've had a chance to actually study the memo, if that's okay. And then I will also emphasize one more thing in response to CMA, or the representative of CMA. It was mentioned among the PA board here, there's no scope creep. Nothing about PA practice changes the way they actually practice. They're not expanding what they do. The practices aren't permitting them to do more than what they are capable of. So I wanted to make sure that there was actual public testimony to verify that. That's it. Thank you.
Ms. Chen.
Thank you for permitting me to speak.
Absolutely. Any other public comment? Okay, Jed, I know you're going to ask this. Can we reopen it for board comment?
Yeah, I would like to ask that.
Well, let me
Mr.
start.
President?
Let me start by doing some commentary here, and I think it's important that we recognize that.
Mr. President?
Yes.
I think we're engaging in a colloquy at this point. We've had board member discussion and public comment twice. My suggestion under the Open Meetings Act is to move on to the next agenda item at this point.
How strongly do you suggest that?
Strongly.
Okay. All right. I will take the advisement of counsel that we may be running afoul of the Open Meetings Act and engaging in colloquy. But if it is on the, we have a new board, we have a new agenda item, right, for next time. and we will leave it at that. But thank you all, the public, for commenting. We appreciate it. And rest assured, I think all my colleagues here do take all public comment seriously from all ends. And it will be considered, I'm certain. And I think you've probably seen that. Okay, thank you, everybody. That is number 10. Sounds like our most exciting agenda item of the day. Oh, yes, let's take a comfort break. It is 10:25. I've lost track of the time during the exciting conversation here. So let's report back at 10:40. Does that make sense?
Yeah, I know.
Okay, very good. Welcome back, everybody. We are back in session. Do we need another roll call? We don't. Do we?
Yes.
We do? Okay. So let's call the roll again. Ms. Caldwell is not in the room. Is there any problem with Rosanna calling the roll, or does Ms. Caldwell need to do it?
We can have Christina.
Oh, Christine, do it, okay.
Mr. President,
Yes.
in my view, you don't need to call roll after breaks. That's something we do in the online format, so we make sure that individuals are present. But if you can see everyone in the room, you can just reconvene.
Debbie Snow joined later, so she was not part of the initial roll call.
Oh, that's right.
Yeah.
Well,
So let's just note for the record that she arrived and what time she did.
Okay, very good.
Okay.
That can be reflected in the minutes.
And I apologize.
That's
It was
quite all right.
5 minutes.
We will assess fines for that on the way out.
I'll pay my dues.
All right, very well. The next agenda item is Dr. Hawkins' report on medical board activities.
Well, thank you very much. Before I give my report, I want to thank Attorney Knutz for being willing to share his personal health information because it acknowledges a recent uptick in COVID-19 infections. Good morning again, and thanks for this opportunity to report some of the important activities of the Medical Board of California. As Vice President of the Medical Board, I'm pleased to present to the PA Board. The Medical Board of California next meet Thursday, August 24th, and Friday, August 25th, 2023. The physical location is the DoubleTree by Hilton in Bakersfield, California. Yes, Bakersfield, California. The agenda is not finalized, but will be viewable at the Medical Board's homepage, mbc.ca.gov, and of course, one can attend virtually. Significant items since my last report. Number one, our Senate Bill 815 Healing Art continues through the legislature. We remain concerned about approval of our requested full fee increase necessary to improve our fiscal status. This is one of the most important requirements that the board has to continue to meet its mission of public protection. Number two, Medical Board California Guidelines for Prescribing Controlled Substances for Pain 2023. This comprehensive update can be downloaded from the board's homepage, again, mbc.ca.gov. Third, on Friday morning, August 25th, at the board's quarterly meeting, there'll be a presentation of discussion on maternal health outcomes in California. And fourth, the board's latest newsletter is anticipated later this month. I encourage physician assistants. I changed it from associates to assistant. I thought I could use associate, but assistants. So I encourage physician assistants and all interested parties to view those two very, very important items that I mentioned previously. One is the updated guidelines for prescribing controlled substance for pain, and the very important and timely discussion on maternal health outcomes in California. The meeting in Kern County, Bakersfield, was triggered by the current president of the medical board, Christina Lawson, an attempt to meet some of the consumer groups where they are and some of their concerns. We usually don't go to the middle of the state like that. It's usually, as it is here, Sacramento area, San Diego, Los Angeles. But this is an olive branch to let them know that we believe they're important. That ends my report. Thank you very much.
Thank you, Dr. Hawkins. Any board member comment?
I have a comment or a question.
Please.
What does the full fee increase consist of, or how much is that?
So the full fee increase, and I should note, it's probably about $1,100. It's not an exact figure for 2 years. The medical board has not had a significant increase in 15 years, 1-5.
Wow.
There was a nominal insignificant $80 increase when we requested a fee increase a couple years ago, but that didn't put a dent at all in what we really need to do our job. So again, we haven't had a fee increase, and we're supported by licensing fees from practicing physicians who are given the pleasure, the honor to be able to practice and provide care to California citizens. So there are challenges with this. They're real. We can't get what we need unless the legislature approves what we need. And we have some challenges as we try to continue to support our missions of public protection
Thank you.
to citizens of California. Thanks for the question.
Thank you.
Any other board comments, questions? Any public comment or question? All right, hearing none, thank you, Dr. Hawkins. Number 12, discussion and possible action on the Physician Assistant Board Strategic Plan, Executive Officer Khan.
Okay, I hope all members had an opportunity to review the draft strategic plan. The board's current strategic plan is set to expire this year. On May 1st, 2023, the board held a strategic planning session facilitated by Solid Training Solutions. The attached draft strategic plan was developed by Solid based on that session. Through this process, the board discussed and developed new objectives for 5 strategic goal areas. 1, licensing and professional qualifications. 2, legislation, regulation, and policy. 3, communication and outreach. 4, enforcement. And 5, administration. Once the strategic plan is adopted by the board, the final version will be sent to DCA's Office of Publications Design and Editing, where it will be put into publishing form. Staff recommendation is to review and discuss the 2024-2028 board strategic plan draft. If the strategic plan is acceptable to the board, staff requests the board adopt the strategic plan as is or as is amended and direct staff to initiate the steps to finalize the document for publication.
Very well, thank you. So folks, I hope everybody's had a chance to look at this, and I invite any comments, corrections, suggestions to the strategic plan. I know we vetted this at great length during our session with DCA, but welcome any comments from anybody.
I don't think we saw a final version of it at the last meeting. I think
We did not.
Yeah, this is the first time I've seen a
Right.
final version.
Yeah.
It's a draft right now.
Well,
It's
that's
a-
what I
yeah.
meant, like the first
Right.
draft.
Mhm.
Right.
Thank you for clarifying.
Yeah.
I wonder if it might be okay if we just kind of went through each goal to make sure we're all comfortable with it. Is that okay with you?
That's absolutely okay. Why don't you go ahead and take the laboring oar on that?
Okay. Careful what you ask for, right? So goal number 1, which is on page 64 of the packet, if you have it, which is licensing and professional qualifications. Cross-train staff to maintain appropriate licensing and processing times and as necessary increase staffing. That seems reasonable
Yes.
to me. Work with PA training programs to increase diversity amongst physician assistants. I think this is great. I mean, it's a good thing. Diversity is good for everybody. But my personal concern is how this fits in with public protection. I'm always hesitant to do anything that doesn't support diversity, but thinking about our strategic plan, like with the mission of the board and public protection, I just there's a few things, this is why I wanted to talk about each goal, because there's a few things in here I'm like, how does that really fit with our plan? And realistically, if you're gonna have a goal, it needs to be measurable and you need to be able to find an outcome. How do we do that here? And the other perspective I have from this is that I work at a PA program and we kill ourselves to do this all the time. And so I'm wondering like how, how the board working to help with that, what that looks like strategically and tactically on the ground level at a PA program. So my concern with this is if we put it in our strategic plan, we need to actually do it. And so maybe we should rethink that, if it's not something that's achievable or practical, that sort of thing.
No, I would agree. I think, diversity is good on a number of fronts, right? There are some outcomes data that shows that having a diverse workforce actually improves health outcomes and reduces healthcare disparities. So, to your point, I think diversity has some inherent opportunities. I guess the question would be, how do we measure success with this goal? Specifically, how do we engage PA programs that, as Jed mentioned, are working on a number of opportunities within their program to increase diversity? That could be your applicant pool, that could be holistic admissions processes. There's all these things that programs are doing to try to influence a diversity of their applicant pool. So the question is, does the board have the resources, the manpower, other things that they would need to try to help to influence that among PA programs? And given the sheer number of programs that we have and those that are developing, we may be biting off a little bit more than we can chew here. So I guess the question would be, how do we measure success? And what does that look like? And how do we engage programs to ensure that whatever goal, whatever number 2 represents in terms of a goal, that is achievable?
So my comment is, work with is terrifically ambiguous.
Yep.
That doesn't, when I read this, I didn't envision us actually taking laboring, or like I just gave Jed, to do anything to these programs that are already out there. So maybe work with should be amended to be support or monitor?
Yep.
Is that more in line with what we're thinking?
I think so. I was just concerned because I'm like, well, it's just kind of nebulous, it's just kind of out there. Ideally, you would have a strategic plan that gets you somewhere. Not sure where this gets us.
Right.
And it might create an additional burden for us that we're not prepared to take on and that is not aligned with our mission, although it
Right.
is aligned with our values and goals.
Yeah, and I just speak a little bit more on that as well. I asked, I think, Jed, when they do the presentation on the PA programs, to look at diversity within those programs so we can begin to monitor how successful programs are in recruiting diverse applicants. I think that would be important for the board to know, and strategically what we can do to best support those programs in achieving their diversity goals.
So should we substitute work with and just put monitor?
Yep.
I think that's better. Yeah. Certainly achievable.
Yep.
We can monitor.
I second that.
Okay. Anybody else think that's
Yeah,
right?
would you not want to support though? I mean, because, what kind of assistance will they need to monitor? I mean, through education or through being available as a resource, so.
I
I
think-
would add, I would like to add support and monitor.
So monitor,
Monitor and support.
And support,
Or support and monitor,
Yeah, and we can decide what level of support that
yeah.
is needed. So I would agree. I think monitor and support sounds like the right message for the goal.
Physician assistant training programs efforts to increase
Yep.
diversity.
Yep.
there
There we
you
go.
go.
Yes, that.
We like that.
I like that.
Yeah, that's good.
Yes, I like that.
And measurable, I'm looking at number 1 too, how do you measure the cross-training and the appropriateness of the staff licensing process times?
I think that's meant to be internal, right? Just our
Right.
staff?
And I think we're already doing that. Is that right?
Yeah.
Is that right?
As an example, like, you remember the last strategic plan, we had significant challenges with board staff and all of that. And so this is a very similar thing that we did in the last one, with giving them the ability to use that, right? Okay, this is in our strategic plan, we take it to the legislature, we say, hey, we need to make more positions, we have to grow. So I think that's a good thing. They're cross-training, they can cover when they're short, and they can grow if they need to. So I think that's something that would be determined by the executive officer and her team in terms of, outcomes and what they're doing. But I think with the rewording of number 2, it's measurable, it's achievable, it's a little more specific.
I'm a goals objective guy, so.
Yeah.
Yeah. Me
No
too.
goals, but there's
I
also
love it.
objectives, right?
That's right,
Yeah.
yeah. me too.
And I think the way that it's written right now, we get into like an ARC-PA kind of,
Yeah.
Yeah.
you know,
Yeah.
stance, and I don't like that.
Right,
So-
a little more specific is,
Yeah.
yeah. So could you read it back, what we're changing it to?
So the modification would be monitor and support physician assistant training programs' efforts to increase diversity amongst physician assistants.
Yeah, I really like that.
Yep.
That's great.
Yep.
That makes sense? Okay.
Okay, goal number
Got that,
two.
Rosanna?
Yep.
Okay.
Goal number two, legislation, regulation, and policy. The first, one- number one under number two is work with stakeholders on legislation to increase licensing fees to ensure adequate funding for board's operations. I think that's okay. Everybody okay with that?
Yep.
Collaborate with stakeholders on regulatory opportunities that will ensure public safety and meet patient and practitioner needs.
That sounds reasonable.
Yep, sounds
Yep.
reasonable, yep.
Okay. Increase legislation and regulation unit staff to review and update regulations as needed.
Yes.
Again, a staffing issue. Everybody okay with all those?
Yes.
Yeah, that appear to give the executive officer leverage to,
Right.
yep, okay.
They can grow if they need to. And this is good for 5 years, right? The
Yes,
strategic plan.
correct.
So kind of thinking ahead to where, 5 years ago, we were a much smaller
Yes.
licensing, our population was much smaller.
We're
so.
very happy to report that we accomplished all the goals set
Yes.
5 years ago, so.
Yes.
yeah.
In the strategic plan, which is
Yes,
fantastic.
Exactly.
One thing in the introduction to the strategic plan, they list 13,000 licensees. We're at almost 17,000, so maybe they could, appropriately document the number. Goal number 3, communication and outreach. Collaborate with physician assistant programs to explain the licensing application process and answer questions proactively. I personally, when I read this, I think it's a little too prescriptive. I would say collaborate with PA training programs regarding initial applicant licensing. I don't know. I just think it's very prescriptive.
Proactively is problematic, I think, for me. That word. So, but
Answer questions as needed.
Well,
I think Jed's advocating to take out answer questions, everything after and answer,
yeah,
right?
Yeah.
right.
Yep. So it'd just be collaborate with physician assistant programs to explain the licensing application process,
Right.
Yeah.
period.
Right.
Okay,
Is that okay?
that's fine.
That makes sense.
Okay.
It's inherent to answer
Everybody else?
questions, so
Yeah.
that's
Yeah.
fine.
Because you folks already answer questions proactively.
Exactly.
All the time.
Yes.
Every
yes,
day.
yes.
As we just
Sure.
heard.
Yeah.
Okay, so that's gonna read collaborate with physician assistant programs to explain the licensing application process, period.
Yep.
Okay.
Strengthen and expand regulatory outreach so that licensees are well-informed and compliant with the law. To me, regulatory outreach, I'm not sure what that means. Regulatory outreach, I don't know what that is. I would say take that out unless someone has a good explanation for what that means. Just strengthen and expand outreach to make sure licensees are well-informed and compliant makes more sense to me. I don't know what regulatory outreach.
I think that was intended to be education about regulations, but I agree that this phrase is problematic.
Yeah, so I guess, based on our previous discussion that we had, right?
Right.
With using the term physician associate and physician assistant, based on regulations and statutes, that's how I'm looking at this, is that we're strengthening and expanding regulatory outreach so that licensees are well-informed of what the law is on certain issues that are pertinent or part and parcel to the PA profession. So I don't have an issue with the wording per se, but again, I agree regulatory outreach seems a little ambiguous.
So if we remove and expand regulatory, no, just regulatory.
Yeah, regulatory, maybe just take out the outreach. Or just
Strengthen and expand outreach so that licensees are well-informed and compliant with the law.
So just omitting regulatory?
Yeah.
Yeah.
Omitting
Is everybody okay with that?
Yes.
with regulations and the law, or the law and regulations?
Well, I think the law means regulations and statutes.
I think,
and-
yeah, I think it's in here.
Yeah.
Yeah.
Does that make sense then?
Mhm.
Strengthen, expand outreach?
Yes.
Okay, so regulatory, strike that. Go ahead, Jed.
Number 3, inform consumers about the services physician assistants provide. This is like consumer education. I don't have any problem with this.
No.
The website or something, everybody okay with that?
Mhm.
Expand board member outreach to increase the diversity of board member applicants. I don't know if this is something that's within the board's purview. It seems like, like the governor's appointment unit and the legislature, this is their domain. I don't know that the board can recruit its own people.
No.
So, when I read this, I thought, well, is that something the board can really do?
I'm just thinking, is it something we need to work with DCA on, or?
Yeah, we have created a pamphlet, also it's the materials on our website as well, to increase applicant pools. So we have done that as far as like, putting it out there that we will have upcoming vacancies.
So does this, just thinking what happens with this a year or two from now, does this mean you send board members places to present on serving in the board, or how would you?
Yeah, see, it's ambiguous. I don't
Okay.
read it that way. You're reading board member as that's a directive for us to outreach.
Right.
I think it meant it more as a descriptive, so if you just removed board member and say expand outreach to increase the diversity of board member
I like the way that, I like the way
Yeah,
that
that's
sounds.
better.
Yeah.
That's
I
clear.
like the way that sounds.
Yeah, it's a little cleaner.
Yep. So we'll strike board member,
Yes.
and it will read, expand outreach to increase the diversity of board member applicants.
Okay.
That's better. Okay,
Yeah, it removes that ambiguity. Okay.
great. Enforcement, hire investigators to reduce enforcement timelines. Is the healthcare, the healthcare,
QIU?
yeah, I can't ever
Mhm,
remember. Yeah. Don't they do all the enforcement? Like, how would we be hiring our
Well,
own?
I would they have sworn investigators. Board can have non-sworn, and that's the direction we're going,
Okay.
as the next phase. So maybe not hire investigators, but, I don't know if you wanna say non-sworn investigators, or do you wanna just say additional staff or enforcement staff? I don't know if we should leave it as hire investigators.
Well, I like additional staff because it gives us more flexibility.
Yeah.
Yeah.
Yeah. So hire additional staff to reduce enforcement timelines.
Yes.
And then you can determine what additional staff means, so
Yes.
whether that's a non-sworn investigator or
Sworn.
whatever.
Yep.
Everybody okay with that?
Yes.
Yeah, good.
Increase the number of subject matter experts to include multiple specialties to reduce enforcement timelines. Is this for the initial review? Is
Yes,
this
for the medical consultant, yep.
So, should we include number of medical consultant subject matter experts, since that's what it's talking about?
I'm sorry, what's your proposal there, Jed?
Well, it just, to me, subject matter experts,
Is-
like, how are you using them? It's vague. So if you're using, increase the number of medical consultant subject matter
Oh, I see.
experts.
Okay.
I just want to, Armando, as far as the medical consultant, so we have a medical consultant program, and then we have the expert reviewer program. I think this
Yes,
is
we
for
do.
both.
It's for
Yeah,
both?
now,
Okay.
now what I'm understanding is, where, one of our goals for enforcement is increase the number of subject matter experts to include multiple specialties to reduce enforcement timelines. I
Yes,
think our intention was for both.
Okay,
Yeah.
Then
so
why
the
don't we say
wording
that?
is,
Yeah.
Increase the number of consultants and experts.
Yeah.
okay,
Yeah.
can I add something to that?
Please.
And it's because, sometimes consultants aren't available, so the more that we have, that we can reach out to, then, we don't have to wait to send that case out for review.
okay.
So it'll be consultants and subject matter experts.
Do we even need subject matter?
Or are they all considered consultants?
Well,
No.
Consultants typically means that they're not gonna testify, where experts mean they may testify.
Yes.
Okay. So
Yes.
consultants and subject matter experts? Is that, want to make sure we get you all that you need in the next 5 years? So we
Yes.
don't want to just say subject matter experts, and then you can't get enough consultants because consultants don't
Yeah,
count, like,
yeah, we haven't broken down in that way, a medical expert and a medical consultant.
Okay.
The medical consultant will do a preliminary review of the case, as an expert is more in-depth, and they actually testify in
okay,
court.
So we need both.
So we
Yeah.
need both, yeah.
Yes, correct.
Yep.
Yes.
okay. So
And I don't know, maybe we can ask Michael, does work product still apply to the consultants, or that's all open, right? Because there's no attorney doing that, the review, right?
That's correct. I think subject matter experts is more of the broad term. But, you know, I think any of those changes are appropriate.
Okay, so it would be consultants and subject matter experts.
Everybody okay with that?
Yes.
Number 3, increase the awareness of the board's enforcement role and responsibilities to reduce complaint resolution timeframes and educate consumers and licensees.
Yes.
Yep.
Okay? Everybody okay with that one?
Yes.
Yes.
Okay. Administration, review the PAB's organizational structure and if necessary, hire additional staff to ensure adequate staffing to accomplish the board's mission.
Right.
This
seems
seems
similar
similar to the other one where we're adding additional staff, so it's almost like a duplicate, right? Because we had another, I think, one of the other goals, but
Yeah.
it aligns.
I think that theme is kind of through many of these
Yeah.
goals of, let's make sure we have adequate staff. And it had, in the past, has been a problem.
Yes.
Yes.
So I think this will help you not have that problem in the future.
Yes.
Educate all staff on key functions and board and cross-train staff. Again, this is the same as a prior one.
Right.
So, identify and implement more paperless processes where feasible to decrease costs and increase customer service and efficiency.
Great.
Everybody okay with that?
Yes.
Don't you improve customer service and increase efficiency?
Yes,
Yeah.
that is correct.
Somebody's undergrad was in,
Yeah.
Yes.
English.
That's right. Thank you for the- correct the grammar.
Yes, improve customer service and increase.
Efficiency.
Yeah, okay, that's good. Okay, I think that's it. Everybody okay with those changes?
Yes.
Yep.
Okay, thank you for,
oh, no, thank you for doing it, because sometimes when I hear somebody, after reading it, and you hear somebody else read it, it,
becomes clear.
yeah, yeah, or you can identify ambiguities, okay, so, thank you. You got everything?
Yes.
Okay, excellent.
Could I ask one follow-on question?
Please, go ahead.
Just, Rosanna, do you, I mean, we've done this before, right? Like, so, last time we did this, we sort of had a brief conversation. Does this strategic plan look like it's workable for the board staff and the EO? Is this gonna give you what you need to accomplish it? Is there something we need to add in here to make this more achievable?
As far as like, us putting in goal areas like enforcement, we need additional staff, then we are repeating that again in administrative, that's a high-level overview, we need additional staff. I think that gives me enough to say we need staff, and I can submit a budget change proposal, so thank you for doing that. I think this does enhance our public protection mandate, and that we will be able to be well-staffed in the future.
And also with, there's several things in here about outreach to the
Yes,
public as
correct,
well?
yes,
So-
exactly.
Okay, thank you.
Okay, so Rosanna, when you make those changes, what's the next steps that happen?
So if you are all in agreement, we can move forward, and I can go ahead and work with them, the DCA, and make this into a finalized copy, or if you want me to bring it back to see what that final copy looks like before you adopt it, that would be our last meeting in November, because our current strategic plan will expire end of this year. So unless you guys are okay with this and move forward, we can just go ahead and say, adopt with amendments or changes, and, give me, authorize me to move it forward and make it final, and finalize this. Otherwise, I'll bring it back in
I'd like you to
November.
do that. We've
That
already
seems,
adopted the changes.
yeah, that seems
Right.
reasonable, just
Okay.
adopt.
Do we need a motion and a vote?
Yep,
or-
it sounds like it, right?
Yes.
We're gonna need a motion to vote, okay. So, the motion is to move forward, direct the executive officer to move forward with the changes we have just made, to submit them for finality, correct?
Mr. President?
Yes?
Mr. President, I'd suggest that the motion be to approve the draft strategic plan with the changes discussed today. And I think there's a great record in terms of what the changes are. So I don't think we need to bring it back.
Okay, great. So that will be the motion that, I made any second?
I second.
Okay, second? Do we need public comment before or after, before the vote, right? Any public comment on the motion? Having heard none, let's go ahead and call the vote.
And the motion was Juan, seconded by Sonia?
Yes, correct.
Okay. Calling the roll, Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist,
Aye.
Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza,
Aye.
Vasco Dion Kidd,
Aye.
Deborah Snow.
Aye.
Excellent, thank you. Thank you, Jed.
Sure.
Okay, 13, update discussion, possible action on proposal to amend the code sections listed in the agenda. Ms. Halbo.
Hello, and we've been working on this particular, which I thought was the simpler of the AB 697 regulation packages. And when we turned it in to the Office of Administrative Law, the application is an online in Breeze, and we worked closely with the Office of Administrative Law attorney to put that online application into regulatory text language. And she was very helpful and also very sure that it needed to be the way she said. So that is what we have, is something that is well chewed over by the Office of Administrative Law attorney, who will make the final decision on it. And it needed to go out for public comment. We included a copy of, the yellow shows just where the changes are. The second version is the clean version. And then a copy of the actual application, so you can understand how this application goes into as text. And the issue is applications, they are a rule of general application. It is, everyone gets the same thing, and therefore it must be in regulation. But we no longer send out a paper application that you just update. It's an electronic, and OAL is pushing to have that written out so that it is fully disclosed to people. So that is what this text is, and it has been sent out for public comment, and as the memo says, we have not received public comments on it. It's pretty clearly just taking the application and putting it into text.
Okay.
And I really want to compliment Jasmine, because she is the master of cheerful nagging with the Office of Administrative Law attorney. It's a fabulous thing, because if I do that over and over again, a lot of my clients will have a sort of irritated person, but when she does it, it's like, oh, it's the client, they really need this. We wanted the public opinion, or the public comment time, to have closed by the meeting, and literally, we sort of pulled it from her hands to send it out. It will close on, I believe, Monday.
Monday, yes, the 7th.
Yeah. And then we will rush to get it turned in to the Office of Administrative Law and adopt it.
So what is it that you need us to do here?
Oh, the action requested, the board is asked to make a motion to adopt the proposed second modified text for 16 CCR, sections 1399.506, 1399.507, 1399.511, and 1399.546 for a 15-day public comment period. And if there are no adverse comments received during the 15-day public comment period, direct the executive officer to take all steps necessary to complete the rulemaking, authorize the executive officer to make any technical or non-substantive changes to the proposed regulations, and adopt the revised proposed regulatory language for 16 CCR sections 1399.506, 1399.507, 1399.511, and 1399.546.
Okay, so pending a motion along that precise motion, any board comment? Cool. Any public comment? All right, very good. So I guess, Michael, the motion would be to go ahead.
So you can just say,
I'm sorry?
you can just say so moved, just say, the best thing to do is just to say so moved as the previous, to the motion that Ms. Halbo read.
Okay, so the motion is to adopt what Ms. Halbo just read.
Are you making the motion?
Yeah,
Oh, okay.
yeah,
I'll second.
okay. Thank you. Very well. Would you call the vote, please?
Okay. Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist. Aye. Sonia Early,
Aye.
Jed Grant,
Aye.
Diego Inzunza,
Aye.
Vasco Dion Kidd,
Aye.
Deborah Snow.
Aye.
That concludes the roll.
Thank you very much. Thank you, Ms. Halbo, Ms. Dillon. Good work. And by the way, I don't think I've ever heard the words cheerfully nagging in the same. So, excellent. All right, very good. 14, Ms. Dillon, update on pending regulatory packages.
All right. So the first package, license renewal and continuing medical education required. Staff is currently finalizing initial documents with Regulations Council and the Budget Office to submit for initial review this month. The next package, SB 697 implementation. Agency approved this package on July 13th, 2023, and the notice was filed with the Office of Administrative Law for publication on July 28th, 2023, to initiate the 45-day public comment period, which will end on September 12th, 2023. And the next package listed as SB 697, application exam scores, addresses, and record keeping. We just covered in the previous agenda item. We had worked with OAL, as Ms. Halbo had said, to amend the text for consistency with the initial license application. And the next package, retired status to include fingerprint requirement. This package is currently on hold until the above packages are completed. And the next package, SB 1441, implement uniform standards related to substance abusing licensees and update of disciplinary guidelines. This package is also on hold until the above packages are completed. And finally, AB 107, military applicant temporary licensure. On January 5th, 2023, the President of the United States signed HR 7939, the Veterans Auto and Education Improvement Act of 2022. And this section added Section 705A to the Service Member Civil Relief Act, which grants license portability to members of the United States military and their spouses. Section 705A permits a service member or a spouse of the service member to practice in a state where they reside because of military orders that is not in the state in which they are licensed to practice. To qualify for the federal practice privilege, the service member or spouse must have a covered license under Section 705A, which means a license with a similar scope of practice that is in good standing with the state licensing entity that issued the license, and that the licensee has actively used the license during the 2 years prior to their relocation. While the board has updated its website with information and created an application for this temporary licensure, completion of the application is not required. To take advantage of license portability, the service member or spouse must provide a copy of military orders that require residency in California to the appropriate Department of Consumer Affairs Board and submit it to the authority of the board for purposes of standards of practice, discipline, and fulfillment of continuing education requirements. In addition, the license must remain in good standing with the state licensing entity that issued the license and any other licensing authority that issued a license with a similar scope of practice. So staff has decided not to move forward with this package because the statutes affected by AB 107 cover in detail the temporary licensure requirements as they apply to our board and thus are self-executing. The board is required to grant temporary licensure to the spouse or domestic partner of an active duty military member stationed in California if the applicant is currently licensed and holds an active and unrestricted license in another state with the same scope of practice as the profession in California for which they would like to practice. This applicant population also receives expedited processing and initial application and license fee waivers. And that concludes my update.
Okay, very good. Any board comment? Any public comment? Okay, thank you, Ms. Halpo and Dylan. You guys did a fabulous job on these things. Appreciate it.
Thank you.
All right, so I guess the general consensus, from what I hear, is continue to push on through if we can. Okay, very well. Number 16, Dr. Alexander and Jed Grant, 15, I'm sorry. Education Workforce Development Advisory Committee.
Okay. So, if it's all right with you, Charles, I'll do the report and just jump in there if you want to. Is that okay?
I appreciate, Jed,
All right.
Jed, your support always, and so, thank you.
Sure. So still, total number of PA accredited programs in the United States is 303. That has not changed. The currently number of accredited PA programs in California is also 20. That has not changed. There are more developing programs in California, which I'll cover more in a second. They're mostly concentrated in the LA, San Diego area. There are 4 in the Bay Area, 2 in the Sacramento Central Valley, and 2 on the Central Coast, so the geographic distribution is still heavily biased towards Southern California, which is where much of the population of the state is, so it sort of makes sense. In terms of developing programs, so just as a reminder, developing means that a program is not yet accredited, but they have indicated to the accrediting body that they are going to open a program and will be applying for accreditation and are in the process of doing that. So there are several developing programs, 6 of them. 2 of the 6 are listed on the accrediting body's website, but their locations are not listed. In particular, the Palm Beach Atlantic University is listed as a developing program in California, but their only campus is in Florida. So I'm not sure if that's an error. I included it, but I did not count the number of students in the 2 developing programs that did not have an address listed. I didn't count, there may be an error, so I didn't count them in the tabulation of the number of potential graduates. CSU San Bernardino is developing a program that's new since last time. The rest of them have been developing, have been listed on prior reports, so we continue to see a lot of growth in California programs, which we expected. I think when I came onto the board in 2013, there were like 9 or 10 programs in California, so we've seen quite a bit of growth there. Provisional means that a program is within its first 5 years of operation. The program is accredited and just new and has more frequent accreditation visits. And you see several of our programs are still in provisional accreditation, which reflects the rapid growth of PA programs within California. Probation means that a program has not met one or some of the accreditation standards and been limited by the accrediting body until they fix those. Probation lasts for 2 years. It can be extended for up to 4 years if the university has not fully become compliant at 2 years, but they're showing good progress. So several programs changed in terms of probation since our last meeting. CSU Monterey Bay is on probation. Dominican University is on probation there in the Bay Area. And the University of La Verne is on probation. They're nearing the end of their probationary period, so they will have to make some changes or may have problems. But probably the most significant one that we should talk about in terms of workforce is Western University was put on probation, and they were barred from matriculating any further students until they complete some probation activities. They are one of the biggest programs in California. They matriculate 98 students a year. And this was particularly problematic for this program because they received this news from the accrediting body about 6 weeks before their class matriculated. So really challenging for the folks that were fixing to start their education. The university, I will say Western University did a really good job of reaching out to other California programs. Like the dean called every program in California and said, hey, we've had this, well, sorry, it's my flies, they're following me. And said, we've had this problem. Is there any way you can help us with these students that would have matriculated in August? And so many programs in California have been working with that group of students that is not able to matriculate. But a significant issue and not a good indicator for accreditation for that program. But they will be given the opportunity to correct that and return to their full accreditation status. So I've left the number on the 98 number on there because they are still teaching out. There are 2 or 3 classes that are still that are in their second and third year of education. So they will still be a part of our workforce, but if that program is not allowed to matriculate students in the next couple of years, then there would be almost 100 students per year less graduating, assuming that they seat a full class. So as we currently stand with our 20 programs, we have 941 graduates a year, and the average number of students per program is 46, the national average is 47, so it's pretty close there. And then 26, once everybody that's planned, that has given a number, and we have can confirm that they're going to be in California, would put us at just under 1,100 graduates per year. Geographic distribution, the map is in there because geographic distribution is important. People tend to practice either where they're from or where they trained. It's not 100%, but it's generally true. And so where the programs are located, it does have some help in meeting unmet workforce needs. And so sort of paying attention to where those programs are located is helpful. This map is not accurate. There are some errors on it, but it does give you a ballpark figure of where things are there. So that's kind of the report on the current state. I will say that working out a program, we are having to pay for a lot more clinical rotations, being very common to pay for clinical rotations now. And that increases the cost of PA education. So I think I didn't include it. I can talk more about the next meeting, but the most recent data from the PA Education Association, I think it's around $150,000 in debt for your average PA student when they graduate, which is a lot of money, but compared to a physician, it's a drop in the bucket, I guess, for those poor guys. So it's still a lot of money. And so when we have to pay for clinical rotations, that sort of thing, that just increases the cost. So I will move on to complete the report and then take questions if that's okay. Last time Dion asked some questions about diversity in PA admissions, so I wanted to make sure we talked a little bit about that today. So the 2 accreditation standards that are listed in the report, A111 and A313, talk about diversity, and I think, Dr. Kidd, your question got not only to applicants but also to faculty, staff, that sort of thing, which is included in the accreditation standard. So you can read those for yourself, but it specifically includes student, faculty, staff, and that there has to be a plan that's supported by the university to try and increase diversity. We talked about this a little bit ago, but certainly diversity is a good thing for patients and the profession in general. So that starts with the policy at the university and the institution, as well as recruitment and retention strategies for students and faculty, and then making policies and resources and things that include increase diversity. So in order to be fully accredited, programs have to comply with these 2 accreditation requirements. We did have a recent Supreme Court decision that talked about considering race as a specific factor in admissions, which is, they said, illegal. It has long been the case in California. It's always been that way. So it's really no change for California programs, which is what we're mostly concerned with. Those policies are on all of the program websites. If they're compliant with the accreditation standards, you can read their policies on admissions, and they're required to specifically state how they apply holistic admissions, if they use those, or what standards they're using to evaluate applicants, and that should be on all their websites. In my check of the California programs, before this, I could only find one program that was a little bit hard to find. Some of it was there. But most of the programs had this information on their websites. And there's a lot of ways to increase diversity without using race. And so many programs have done that. The program where I work, we use things like socioeconomic factors, which are reported by every applicant, their life experiences. So we'll ask them questions to help, where they have an opportunity to talk about maybe some challenges that they've had because of DEI type issues, where you can include some factors related to that, but they're not specifically focused on race, and we've been able to really increase our diversity by employing some of those practices and admissions, which are, increase fairness and diversity at the same time. I would say that generally California, based on, we talked about some of the data in the last report, but California programs are generally more diverse than other programs in the nation. So I think we're doing well on that, but we can always do better. So I will accept your questions.
I have a question. Do you find with the developing programs, are they virtual? Do you have any information on it being virtual or?
So there's one, the Toro program in LA. Looks like it's going to be a virtual program, but I don't want to speak for those programs, but just in looking at the websites and some of the documents, it looks like that may be virtual. But the rest, I'm not sure. They look like they'll be in person, but those other programs that don't have an address, Alliant is an online university, so if they are opening one in California, they will likely be online. Palm Beach is an in-person university in Florida. I'm not sure if they're opening a satellite campus here or what they're doing, but they do have a PA program in Florida.
Okay. And then had you heard anything about the Western, it's very rare. I think in all of the years, I've never seen a program stop at matriculation. They've always been in a teach out. So that's just.
So they do, I'm glad, thank you for asking that question. So Western is not barred from teaching out. So they are still, the currently enrolled students are still enrolled and they are still continuing to train those students.
Right.
All they were barred from is matriculating another class. And I have seen that happen before.
Okay.
It's usually a poor prognostic indicator for the program for accreditation.
Right.
But they have not been barred from teaching out their current students. So I think they have right around 200 students still currently in the program.
I just hadn't seen the so
Yeah,
I've only
it's-
seen a teach out versus not like a matriculation, so.
Yeah,
that's good.
it's very concerning for them.
It's very concerning.
Yeah.
It's very concerning for California, so.
Yeah.
And as an alumni of Western, it's extremely concerning to me.
Yes.
Great program for many decades. Question that I have, so how, typically when you put on probation for a couple of years, you have a couple of years to clean up the standards and make sure that you're compliant. Have we seen in any other California programs where you're not allowed to matriculate? Because some programs you put on probation, but you're still allowed to matriculate students.
Right.
To Sonia's point, every program has to have a teach-out clause.
Right.
In the event that they go under, they have to have a way
Right.
of teaching out students. But in this case where Western has had really a great track record of accreditation decisions to now 6 weeks, not being able to matriculate students, which is almost like surrendering your program to a degree, right? And then having to try to, so I wanted to get your thoughts around that, and then I'll have just one more follow-up question.
Sure, yeah, barring matriculation from an incoming class indicates that there's significant deficiencies in accreditation, meaning that there's multiple standards that the accrediting body feels they are not meeting. They did, on the Western's website, they did note that they appealed this decision and the decision was upheld, so they lost their appeal. I was the program director of a program that had this happen to it, so I know exactly what it means. And that's why I say it's really, it just indicates that there's really severe deficiencies and major changes are gonna have to happen to overcome those deficiencies, and that the accrediting body was so concerned about their ability to meet the accreditation standards that they wanted those standards addressed before more students came into the program. That's what that means. It's a bad indicator. And how the program responds to this, the accreditation process can feel pretty unfair because the standards are written broadly, yet they are often interpreted pretty narrowly for the program. But the bottom line is, that's the accreditation standard, and if they say you're not meeting it, you got to figure out how to fix it and meet it. And so I'm sure they're working diligently to try and fix that. And the hope is that they'll be able to do that. They will hear, according to them, in 2025, this decision will be revisited, and they may be allowed at that point to matriculate more classes, or something else will happen. But they barred them from this class, and it sounds like the next year's class as well, since they won't be allowed to matriculate until 2025.
Thank you for that. Then a follow-up question, you had mentioned about paying for hard-to-recruit clinical rotations and kind of passing that cost burden on to students. Are you seeing a decrease in the applicant pool? Because as the costs continue to rise, people would then have to make a decision of, do I go to PA school for $150,000 or go to medical school for maybe $100,000 more? What are your thoughts around that? Because we are seeing, and it's not just PA programs, as you mentioned that, but medical schools, nursing programs are also paying for clinical sites. And we're starting to see a lot of inflation in terms of what, clinics and medical groups and hospitals are charging to have students rotate at their sites. So I wanted to get your thoughts around that, because the last data that I looked at showed that 50% of programs are now paying for clinical sites.
Yeah,
And that number is going up.
It is going up, yeah. At least 50% are paying for at least one. But many of those programs are, and that data from PAEA showed that, but many of those programs are paying for multiple sites. So the average cost is about $1,000 for a 1-month rotation. There's 8 required rotations, so if that's $8,000 to $9,000, depending on how long their rotations are, that of additional cost, and that's usually
Per student.
Per student,
Per
yeah.
student,
It's relayed directly to the student. Some programs have this built into their tuition already. They were kind of planning for that. Right now, women's health, so OBGYN and pediatrics and behavioral health seem to be the ones that most people are paying for. So Dr. Hawkins, maybe if you want to share with the medical board that your colleagues in those specialties, if they have any desire to help out, that would be awesome, because it's often hard to find preceptors in those specialties. But I think that's why, is it's gotten more competitive. You have less rotations available. You just have to do something to try and be more competitive. And then we've also had bigger programs that have multiple locations in multiple states come into California. And rather than sort of following the traditional patchwork method of kind of going out and finding people and getting them to do it, they just started paying right off the bat, which was successful for them. They were able to get a lot of preceptors, but then that changes the bar for everybody, right? Now, well, these guys are paying, so, happy to take your students for a price. And so it just kind of happens everywhere. But the bottom line is the limiting factor for PA education is clinical rotation sites. That's the limiting factor. So,
Thank you.
Question, Jed. So the 50% that are not having to pay for those rotations, are those primarily at where there's a university like Stanford or USC, where there's an ability to sort of say, this is part of what you have to do?
Yeah, it's really interesting to say, well, are these programs affiliated with a medical school? And interestingly, it's the same, right? Yeah, so, if you have med students rotating and the PA school says, oh, we want to have some PA students rotate, they'll charge them, even internally. So it's pretty evenly distributed across the board. So you would think that they would get a discount, but.
Also, to add to your question, there is no decrease in numbers. We are seeing an increase in numbers.
Oh, that's right.
in
I
schools.
didn't answer
So-
that. Yeah, if you look at PA admissions overall, it's extremely competitive.
Extreme.
So typically, just for the average applicant in 2021, which is the last data from PAEA, applied to 8 programs, interviewed at 3, and was accepted by 1. And there's about a 38% first-time acceptance. So only maybe 40% of people are accepted their first year. For our program, we have 45 seats. We get about 2,500 applicants for the 40 that are qualified. We get more than that are not qualified, but 2,500.
That's a pretty impressive applicant pool.
And it's increasing, and the GPAs are near 4.0.
Yeah.
And so it is highly competitive. Wow.
Yeah. The national average for GPAs, like 3.6, 3.7. For overall and science GPA
Yes.
equally. And most applicants have about a little over 3,000 hours of healthcare experience coming in. So it's just, and they've often done research, and I look at these applicants and I think, I would never get into PA school now. It's a good thing I went back when they accepted knuckle draggers, because it's really challenging to get in.
In the most recent applicant pool, on average for the students that I interviewed, 3.9 GPA, science of a 3.86.
Wow.
Stellar and impressive, in terms of work hours, work experience, and just total package. But I was like, oh my gosh, this is really competitive. So the numbers are not decreasing, and they know about physician assistants and are eagerly pursuing their life's aim, so.
And if I can just add one more comment, sorry, I don't want to monopolize all the time on this, but this is important in terms of one of our goals of how we monitor and somewhat support PA programs in terms of their diversity. The accreditation actions, which are published by the ARCPA regarding every program in terms of whether they're non-compliant with a specific standard that's published, it'd be good for us just to monitor some of our California programs if they're non-compliant with the diversity standards that ARCPA set, because we would be able to see that actually published on their ARCPA website, and specifically on the program's website, I think, right, correctly. So just something to kind of add to our report
Data.
out.
Yeah, for sure, we could definitely do that. And I did look for some of that. If the program, when the accreditation decision comes out, if they appeal that and enter the appeals process, all that data is removed from the website. So you can't see what they were cited or anything else. From the accreditation website, sometimes the programs will still have it on theirs. But once the decision from the accrediting body is finalized, it should be available on their website, so that's something we can definitely.
Yeah, and I was mainly referring to the citations
Right.
around, as opposed to the observations that you
Right,
get.
right.
Yep. Thank you.
Other questions?
I just have another question for you. I can attest, again, the increase in application thanks to Sonia and Jed, visiting our school to recruit. But I wanted to ask you about Dominican University, because I noticed they're on probation this time and wasn't on the report last time. Did you find out anything about their status?
I just know that they're on probation. I don't have any information as to why. They should have it on their website, and the ARC website may have that as well. I did note that I checked this about 2-3 weeks ago, and when I checked, the ARC website didn't have the data posted for the program, so it may have been updated since then.
Okay.
But that's where you would find it, like why they're on, like the reasons, and they have those. Basically, there's two things that Dr. Kidd talked about. They can have an observation, which is when a site visitor comes out and they say, oh, we observed this. The program is given an opportunity to address that. If the accrediting body still feels like, yeah, the observation was accurate, then they're given a citation, and that citation is what's counted later. So sometimes that can take a little bit of time for all of that to work itself out. The next report from the ARCPA will be out in September, and I expect that we'll have more data there, which I'm happy to share at the November, we can share at the November meeting.
And also, I'm wondering, with the new DEI standards, if some of these schools might fall into the probationary category because of that. If you're not meeting a particular standard, you could actually fall into the probation category as well.
You can, yeah. The accrediting body is actually really good. These standards are new. They were introduced, I think, in September. And they're really good about sending out advance notice and saying, hey, here's a new standard, and they have a manual that says, here's ways that you can demonstrate compliance, and they warn the programs, we're gonna be looking for this. And so the programs, they usually have adequate time. So like when this standard came out, they specifically said, we're not gonna be looking at this for people who already have a site visit scheduled in the next 6 months, but after that, it's fair game. And so the programs, it shouldn't be the sole reason for their probation.
Right. Okay.
So, and usually to be put on probation, a program has to have citations across multiple standards, not just one standard, or if it's a critical standard where they're doing, something bad, like your students aren't passing. Yeah, that's what.
Okay.
Other questions? Okay, great, thank you. Concludes my report.
Great.
Thank you.
Thank you.
Thanks for the clap.
Thank you, Jed.
Any public comment or public applause? All right, very good. Thank you, Jed. Okay, number 16, report by the Legislative Committee. Ms. Dillon.
All right, so these bills were introduced at the last board meeting. Most of them have not been amended, but I will go through one by one, and if anyone has any comments or suggestions, we can discuss them one by one. So AB 883, Business Licenses, United States Department of Defense Skillbridge Program. This bill would require a board to expedite the initial licensure process for an applicant who is an active duty member of a regular component of the Armed Forces of the United States enrolled in the United States Department of Defense SkillBridge program. The SkillBridge program is job experience focused and it's unclear whether it would help enrollees meet qualifications for licenses that require a specific type of education or passage of an examination unless those requirements are completed ahead of time. As a result, those enrollees may not benefit from an expedited application. And therefore, our board does not anticipate any fiscal impact as this bill should not affect our board. Any comments or questions on that one?
By no fiscal impact, you anticipate that we have no extra staffing burden?
Extra staffing or, yeah, extra, staff time to implement this bill in any way.
Okay.
So what was our position on it?
I don't see a position here. Did we have a
Did we have a
position on it?
position?
No, the board did not take a position on this one last time.
So is this something that we would want to take a position on? So just to make sure I understand it, this is for people that are enlisted, so this is a way to facilitate,
Correct.
right?
Those enrolled in the SkillBridge program, which it wouldn't really benefit our board because we do require a program completion and the passage of the exam before they can even apply.
Correct.
So,
Okay.
So it doesn't sound like we do need to take a position on this. Anybody disagree?
No, I think it's more of a vocational type thing, less of a professional thing, so.
right,
Doesn't, I don't think we
yeah.
need to.
Okay, so we should leave it with, everybody, kind of sounds like we're in agreement, leave it with no position?
Yeah.
Okay, all right.
Okay. Moving on to the next bill, AB 996. This bill proposes that boards under the Department of Consumer Affairs develop and maintain a conflict of interest policy that would discourage the qualification of any continuing education course if the provider of that course has an economic interest in a commercial product or enterprise directly or indirectly promoted in that course and requires conflicts to be disclosed at the beginning of each continuing education course. And the board did take a position on this bill at the May 1, 2023 meeting, and the board took a watch position on this bill. I have spoken with the author's office on this bill, and there is a chance that this could be a spot bill, which means that the language of this bill could be completely changed, and none of this would apply to this bill. But as of right now, this bill is still it still covers the conflict of interest policy.
And it's still in committee, okay. All right, so we took a watch position. Seems to me that that should be the position we continue to take to see what they may change on it. Anybody disagree? Okay. All right, we're good.
Okay, so moving on to AB 1028, reporting of crimes mandated reporters. This bill would remove the requirement that a health practitioner make a report to law enforcement when they suspect that a patient has suffered physical injury caused by assaultive or abusive conduct. The bill would instead require a health practitioner who suspects that a patient has suffered physical injury that is caused by domestic violence to provide brief counseling, education, or other support, and a warm handoff or referral to local and national domestic violence or sexual violence advocacy services. And this bill would also specify that a health practitioner is not civilly or criminally liable for any report that is made in good faith and in compliance with these provisions. Regarding fiscal impact, the board would need to provide an update of mandated reporting information included on the board's website. And this is something that can be done by staff and supported by the board's current pro rata costs to DCA. And at the May 1st meeting, the board did take an opposed position on this bill.
Well, it's still in committee, so again, I don't see any reason to change our opposed position unless anybody has any different comment. All right, so we'll leave that the way it is.
Okay, moving on to AB 1070, physician assistants, physician supervision exceptions. This bill would authorize a physician and surgeon to supervise up to 8 physician assistants at one time if the physician assistants are focused solely on performing in-home health evaluations to gather patient information and perform annual wellness visits or health evaluations that do not involve direct patient treatment or prescribing medication. And the board did not take a position on this bill at the last meeting.
Comments?
Please.
Okay. So the medical board views all bills through the lens of quality of care and public protection. We recognize that these patients, which are often homebound and quite vulnerable. 2 weeks ago, the board shared its concerns with the author. There have been some improvements in the language that addresses some of those concerns, such as identification of the 8-to-1 supervision ratio. But we still have some concerns. One is, are there limits on the number of patients that can be evaluated in a day? Second, the questions on specifics of what occurs in that evaluations. Since, for example, although we recognize a nurse is not a physician assistant and vice versa, some of what's being offered, because remember, these are home care patients. Some of those services are now provided by nurses that are then the physician authorizes the plan of care. Next, how the visit will be documented. For example, will it duplicate what the physician would do in what's called a Medicare annual wellness exam? And finally, how the visit's information will be managed by the supervising physician. Essentially, need more detail. We wonder whether this is more of a business model. So these are some of the concerns that the medical board had.
Any other comments? Well, it didn't occur to me that it would be important to see how many they're actually treating or seeing. Yeah. Well,
Again, these are, please correct me if I'm wrong, these are actually patients or individuals who are at home, part of a home health evaluation. So many of them are quite vulnerable, friable, et cetera. It's not going, there's a specific group of patients that are carved out. Correct me if I'm wrong, please. That relates to the home health evaluations.
Yes, that's correct.
So we did not take a position previously?
No, the board did not take a position.
The medical board hasn't opposed.
Medical?
Hasn't opposed unless we get more information, more clarification. We sent that letter 2 weeks ago to the author, Lowe. Again, through the lens of quality of care and public protection. We're not talking about business competition. We're just talking about what's being provided to the patients.
Well, what does anybody think? Do you think we should change position on this? I'm concerned what Dr. Hawkins pointed out. I don't know if we should watch it or, since they've already opposed, what does anybody think?
I don't think, just me personally, I don't think we need to take a position on it. I mean, PAs do the annual Medicare visits all the time. That's not unusual for them. Typically, those visits don't include prescribing medications. It's more of a, how are you eating? What's your weight doing? Like, how are your, all your sort of annual check-in stuff. I do see the concerns that those are legitimate, like, if you're scheduling these visits every 30 minutes, like, you're not going to be given good care, that kind of thing. So I see where they're concerned, but I don't know that we need to take a position on it. At least I don't feel like we do.
I'd agree with that. I mean, I think, all the points that Jed raised, again, these are essentially, for the most part, benign visits, right? So I think, there are some concerns that were discussed here, but again, I don't think we need to take a position on the bill.
So one of the questions would be, what's the purpose of the bill? Which doesn't have to be answered here.
Okay, well then, unless anybody has any other comments, I guess we'll leave that with no position. All right?
Okay. Moving on to AB 1707, Health Professionals and Facilities Adverse Actions Based on Another State's Law. This bill would prohibit a healing arts board under the Department of Consumer Affairs from denying an application for a license or imposing discipline upon a licensee on the basis of a civil judgment, criminal conviction, or disciplinary action in another state that is based on the application of another state's law that interferes with a person's right to receive sensitive services that would be lawful in this state. This bill would similarly prohibit a health facility from denying staff privileges to removing from medical staff or restricting the staff privileges of a licensed health professional on the basis of such a civil judgment, criminal conviction, or disciplinary action imposed by another state. This bill provides that these protections do not apply to a civil judgment, criminal conviction, or disciplinary action imposed in another state for which a similar claim, charge, or action would exist in against the licensee under the laws of this state. And at the May 1st meeting, the board took a support position on this bill.
Does anybody see any reason to change that support position? Okay. Very well, we'll leave that as it is.
Okay, moving on to SB 345, Healthcare Services, Legally Protected Healthcare Activities. This bill would also prohibit a board from denying an application for licensure or suspending, revoking, or otherwise imposing a discipline on a licensed person because they were disciplined or convicted of an offense in another state if that disciplinary action was for providing a legally protected healthcare activity. So it's similar to the previous bill, and at the May 1st meeting, the board also took a support position on this bill.
Again, does anybody see any reason to modify our position from support? All right, hearing none, we'll move on to the next one.
Okay, SB 372, Department of Consumer Affairs, Licensee and Registrant Records, Name and Gender Changes. This bill would require boards to update a licensee's records, including records contained within an online license verification system, to include the licensee's updated legal name or gender upon receipt of government-issued documentation that demonstrates a legal name or gender change for that licensee. The bill would require the board to replace references to the licensee's or registrant's former name with the individual's current name or gender as applicable on the publicly viewable information displayed on the internet. This bill would prohibit a board from publishing information relating to the licensee's or registrant's former name or gender online. Instead, the bill would require the board to post an online statement directing the public to contact the board for more information. For specified licensees or registrants, the board would be prohibited from posting enforcement records online, but would be required to direct post an online statement stating that the individual was previously subject to an enforcement action and directing the public to contact the board as prescribed. The bill would provide that all records related to a request to update an individual's license or registration under these provisions are confidential and not subject to public inspection or disclosure. The bill would require the board, if requested by a licensee or a registrant, to reissue any license created by the board and conferred upon the licensee or registrant. The bill would prohibit a board from charging a higher fee for reissuing a license with an updated legal name or gender than the fee that it charges for reissuing a license with other updated information. And at the May 1st meeting, the board took an opposed position on this bill.
Any reason to change the opposed position from anybody? I recall we didn't like that one at all, okay. All right, next one.
Okay, so SB 385, Physician Assistant Practice Act, Abortion by Aspiration Training. This bill specifies that the required training necessary for a physician assistant to receive authority from their supervising physician and surgeon to perform abortion by aspiration techniques must include a clinical and didactic component and be provided by either a physician assistant board approved training program, training to perform medical services that augment the physician assistant's current areas of competency, a course offered by a state or national healthcare professional or accreditation organization, training based on the competency-based training protocols established by the Health Workforce Pilot Project, number 171, through the Office of Statewide Health Planning and Development, now known as Department of Healthcare Access and Information, or training and evaluation of a clinical competency performed at a clinic or hospital on performing abortion by aspiration techniques that is provided by a physician and surgeon, nurse practitioner, certified nurse midwife, or physician assistant authorized to perform abortion by aspiration techniques. And this bill also clarifies that a physician assistant who completes requisite training and achieves clinical competency is authorized to perform abortions by aspiration techniques without the personal presence of a supervising physician and surgeon unless specified by their practice agreement, and that the procedure must be practiced consistent with applicable standards of care within the PA's clinical and professional education and training and pursuant to their practice agreement. This bill specifies that nothing in these provisions is to be interpreted as authorizing a PA to perform abortion by aspiration techniques after the first trimester of pregnancy. And at the May 1st meeting, the board took an opposed position on this bill.
So question, is the letter we received from Senator Atkins' office, I didn't see it in here. Is it-
It was just sent to Jed and yourself.
Okay, so Jed, Michael, and I actually had a conference on this with Senator Atkins' staff, and Jed ably pointed out that in practice, what this bill actually does is impose an additional educational requirement on PAs that doesn't exist now. So although the intent of this bill is to expand ability for this particular service, as a practical matter as applied to PAs because of SB 697, it actually restricts it, which is why we opposed it. We tried to explain the basis, and the response, as I understood it from the staffer, was that, no, we're just following a national standard. And we said, well, if we follow that national standard, you're actually restricting us. They promised to look into it and get back to us. We did receive a letter. I don't think the letter changed anything. It just said the same thing we heard in the meeting. We're using a national standard we hope you support. I think the policy is a sound one, but its actual implementation as this bill is worded, and we actually suggested how they could fix it quite simply as it relates to PAs, and we did not get a favorable response on that. So, Ed, Jed, do you have anything to add, or Michael?
I would just add that, with the language that we proposed to them, we could support the bill. So we might consider changing our position to support if amended, which is a little more encouraging for them to change, because it's a really small change. We had them remove the didactic component, and there's a lot of repetition in some of these things in the bill that we removed. It's really small changes, but they didn't even entertain a conversation about it, so maybe that might encourage them to make that change.
I think that's sage advice. Michael?
If you're going to go to a support if amended statute, or a position, excuse me, I'd recommend that you, in doing so, identify the specific textual amendments that you want to the bill. Because ultimately it begs the question, support if amended how?
So do we do that by directing the executive officer to dispatch a letter incorporating the amendments that were suggested at that meeting?
No, I think you'll have to propose those amendments today, and so they're in the record in terms of what exactly you want. It would actually be preferable to have that in writing as well.
Jed, do you have your notes on that?
I can find them. Do you have them?
Yeah,
Rosanna?
I have it here.
Okay. Why don't you share that?
Oh,
Strike from here all the way to the end of the paragraph, replace it.
Oh, I found it.
If you have it, go ahead.
Waiting for it to open, sorry.
Okay.
Okay, so the bill itself, I'm gonna go refer to that.
Did we send these proposed changes to the author?
Yes, and then we had that meeting with him.
So
yeah.
we sent these before I made these after the meeting.
No, this was, we sent it to the staffer, and then we had a meeting with him, and this was part of the attachment that we sent them. And then after the meeting, they still sent that letter.
Okay.
Yeah.
So they've had these changes?
Oh, yes, yes. So it's basically removing the, striking out where it says include a clinical and didactic component to strike and didactic part from the bill.
And then under subparagraph 3, where it says accreditation, changed that to accredited educational organization.
Yeah, professional organization, accredited educational or accredited educational institution.
And then under, subparagraph. Go ahead, Michael.
Go ahead, Michael.
I was just going to say, if those are all the changes, then I think that's a clear record. And you could at this stage make a motion to support the bill with amendments as discussed in the meeting.
I can add the final amendment, which was under subparagraph B, where it talks about once the PA is competent, they can do it. Just says, if the physician assistant is performing abortion by aspiration techniques without the personal presence of a supervising physician, the practice agreement shall specify, 1, the extent of supervision by a physician assistant and surgeon with relevant training and expertise, and 2, indications and procedures for transferring of the patient's care to a physician and surgeon or a hospital.
Okay.
Takes a
so-
lot of the other listed, if it's a Tuesday, do this.
So is that a sufficiently clear record, Michael?
I wasn't able to locate that provision, but I think it is. I'm just trying to find it.
Well,
The last one?
Yeah, it's a variation of what was in F that is stricken out in our, is that right, Jed?
I think it was under B. Gosh, I wish I had I have the document here, but it has so many changes on it with different numbering that it's hard for me to tell what the original numbering was. It used to be C, and then it was B, under number 5A,
So it's the new B.
5B, yeah, it's the new B for A5B.
That begins a physician assistant who has completed training and achieved clinical competency?
Yes, sir, that's correct.
Okay. If the changes were clear to everyone, yes, I think that's a clear record, and you can proceed with a motion to support SB 385 if amended per the conversation today at the meeting.
So just a quick clarification, because I don't think all have the same notes you folks have. So just to make sure we're clear, just I'm clear, we're removing the didactic component, which is very prescriptive by the bill, and we're saying that the level of competency and anything else associated with that type of care would be determined at the practice level, which would fit within the confines of Senate Bill 697. And so the edits that we're making are ensuring that that extra burden is removed so that the physician and the PA team can determine what level of competency through the practice agreement the PA can do that. So is that what we're saying, just to make sure that we're all clear there?
That's exactly right.
Yeah,
Okay.
precisely.
Okay.
Yeah, that's right. Which was our big opposition to the bill in the first place, is like, this should be figured out at the practice level,
Okay.
not prescribed by the legislature.
So, do we have a motion as indicated by Michael?
I'll make the motion.
Okay. I'll second, I guess. And before we vote, any public comment? All right, can we call the roll?
Before we call the roll, I just have a question on the position. So right now, we're oppose, right?
Yes.
So could you help me understand the difference between oppose unless amended and support if amended?
Yeah, I have a sheet at the beginning of the agenda item. Here, I have the definitions. So oppose unless amended. The board will take an opposed position and actively lobby the legislature to amend the proposed legislation by requesting specific amendments to alter the text of the bill after it's been introduced. And then support if amended at the bottom there. It says the board will take a support position and actively lobby the legislature to amend the proposed legislation by requesting specific amendments. So it's just, the position.
You're going to work against it unless you change it or work for it?
Right, yeah.
Essentially, they mean the same.
Essentially, yeah. Yes, yes.
Okay. One's just a little more
Polite.
Positive.
the positive, yes. a
Yeah.
little more polite. Well, I think we certainly want to be polite to the legislature, especially members who are on the certain committees. I think this is a good, I mean, I see what they're trying to do, which is increase the ability for PAs to perform this procedure, which is great, but yeah, I think support if amended is appropriate, if you guys are okay with it.
Okay, great. So the motion having been made and seconded, any public comment? All right, if we can call the vote, please.
Charles Alexander,
Aye.
Juan Armenta,
Aye.
Jennifer Carlquist. Sonia Early,
Aye.
Ted Grant,
Aye.
Diego Inzunza,
Aye.
Vasco Dion Kidd,
All right.
Deborah Snow.
Aye.
Okay, great, thank you. So the next one is what, 544?
Mr. President, before we move
Yeah.
on, does, when this letter goes to the legislator, will it include the language that we?
Yes.
Okay.
Yep. And we'll include it in the next meeting material, as Jasmine did for prior letters that we've sent.
Okay,
Yeah.
thank you.
Juan?
Yes.
Can you reiterate who made the motion and who seconded it?
I think
I
Jed made
mean-
the motion and I seconded it.
Thank you.
Okay, so.
Very well. 544?
544, SB 544, the Bagley-Keene Open Meeting Act teleconferencing. This bill has not been amended, and it removes the Bagley-Keene Open Meeting Act, removes from the Bagley-Keene Open Meeting Act indefinitely requirements that a state body post agendas at all teleconferencing locations, that each teleconference location be identified in the notice and agenda of the meeting or proceeding, and that each teleconference location be accessible to the public. State bodies shall provide a means by which the public may remotely hear audio of the meeting, remotely observe the meeting, or attend the meeting by providing on the posted agenda or a teleconference telephone number, an internet website or other online platform, and a physical address for at least one site, including, if available, access equivalent to the access for a member of the state body participating remotely as specified, and requires the agenda to provide an opportunity for the public to address the state body directly. The bill provides that one staff or member needs to be physically present at the physical location specified in the meeting, as opposed to existing law, which requires a member to be present. And at the May 1st meeting, the board took a support position.
And does anybody see any reason to change from that support position? Okay, I guess we'll leave that as it is.
Okay, and finally, SB 802. This bill, in addition to the existing requirement to notify an applicant in writing when the decision to deny an applicant for licensure is made, it would require that such written notification be carried out within 30 days of that decision. And at the May 1st meeting, the board took a support position on this bill.
And does anybody see any reason to change that support position on this bill?
No.
Very well. We'll leave that as it is. Jasmine, thank you.
Thank you.
Okay, that concludes item 16. Now brings us to 17, agenda items for next meeting. So we have, what, Member Snow promote,
Correct, yes.
and so how did we term that item?
I will watch the webcast again and then write it.
Mr. President, I think it would be, we can determine, the board president sets the agenda for the meeting, so we can determine how to put that on the agenda
Okay, we can take that
at a later date.
At a later date, okay. Just so everybody knows, I do think I'm going to recommend when we set the agendas, the feasibility of virtual public participation, just a feasibility discussion. And I think also we should have a discussion about the feasibility that was suggested to us of an examination to gather data of who is using assistant versus associate, just a discussion about the feasibility of that. And I think Rosanna will be able to tell us what stressors or non-stressors that will place on her staff. Okay? I think we should also place on the agenda discussion of moving forward. I'm alarmed by seeing the decline in the months we have in reserve, or years we have in reserve. I think we should, as the medical board is increasing fees, I think it's probably, we might as well throw the iron in the fire saying about increasing fees. They are so modest for PAs that I'm astounded.
What about going back to some virtual meetings, at least one in a year for us, so that we could decrease costs that way, instead of increasing fees?
Let's add a feasibility discussion on that as well. Okay? So with that, we are going to move to closed session, and we will adjourn from closed session. Michael, is there anything else I need to do before we enter closed session?
No, I don't believe so. So our agenda specifies that adjournment won't be broadcast or webcast. So with this, the public portion of the meeting is concluded.
Okay, very good. Thank you, everybody. Thank you. We will move to closed session.
May I
Absolutely.
request, help